Laura, you gotta watch the cameras over there.
Where, in the sand? I'll go there. The only place you'd find me is in the Coach outlet if it's still there, and I wouldn't even really be there.
Are we all ready? Everybody?
I don't spend money, I'm not getting something back.
Nobody on the phone?
No, who's on this? Who's
Okay.
personnel? Who's,
Okay, you and I. That would be you and I.
okay, who's on the phone, anybody?
No. Good afternoon, everyone. I'd like to start the Personnel Committee meeting. It's 4:00. We are recording. And if you do speak, please get close to the microphone because there's a lot of people watching on YouTube. That's what I'm being told.
This is the big thing to watch it for.
Courtesy to the floor at this time. Seeing none, we're going to move right into the agenda. Review of the county executive's appointments. We have a new packet here. Individuals for reappointment for public director to the Conservation District Board. We have Lynn Stauffer from Bath. And it is a 4-year term beginning December 31st, 2020 to end December 31st, 2024. Questions, concerns, recommendations?
Motion to move forward.
Thank you. Next, we have a reappointment for the Farmer Director to the Conservation District Board. Brian Fulmer of Penargil. Mr. Fulmer is being considered for a 4-year term beginning December 31st, 2020 to end December 31st, 2024. Questions, concerns? Motion to move.
Motion to move.
Thank you. So moved. Next, we have an appointment for the Drug and Alcohol Advisory Board. Kathleen Earhart of Hellertown. Ms. Earhart is being considered for a 2-year term to begin November 20th, 2020 and to end June 30th, 2022. Questions, concerns? Motion to move.
Motion to move forward.
Next, Lehigh Valley Planning Commission as citizen representative. An appointment. Andrew Elliott of Palmer. Mr. Elliott is being considered for a 4-year term beginning January 1st, 2021 and to end December 31st, 2024. Questions, concerns? He has a resume attached. Motion to move?
So moved.
Thank you. Okay, these are reappointments for Lehigh Valley Planning Commission. A reappointment for Susan Lawless. Ms. Lawless is being considered for a 1-year term beginning January 1st, 2021 to end December 31st, 2021. Motion to move.
So moved.
Thank you. And another reappointment for Pamela Pearson for the same term, January 1st, 2021, December 31st, 2021. Motion to move. Thank you. Next, we have another reappointment for the Lehigh Valley Planning Commission, Gerald Yob, Councilman of Freemansburg. Mr. Yob is being considered for a 1-year term, January 2021 and December 31st, 2021. Motion to move for Mr. Yob. Thank you. Okay, Mental Health Early Intervention and Development Programs Advisory Board for Frank Palumgruto.
Palagrudo.
Thank you. Mr. Palagrudo is being considered for a three-year term beginning January 23rd, 2021 to end January 23rd, 2024. And his resume is attached. Questions, concerns? If not, motion to move. Move. Thank you. Okay. Mental Health Early Intervention and Development Programs Advisory Board. We also have an appointment for Penny Evans. Ms. Evans is being considered for a 3-year term beginning November 20th, 2020 to end November 19th, 2023. Questions, concerns? Her resume is attached.
Someone is waiting to get into the meeting. To let them in and allow anyone into the meeting, please press *8.
Motion to move?
So moved.
Thank you.
Now, anyone who tries to join will be allowed.
Okay, that's it for the appointments and reappointments. Now we have a consideration for review of personnel requests from, the first one's from Graysdale. It reads so as, Graysdale is seeking your approval of 2 positions to be presented to council at the next Personnel Committee meeting on November 18th, 2020. The positions are in Compliance Nursing Mental Records Administrator. Both positions will assist in reduction overtime of current employees and assisting with tasks that require more time and attention than the current position control allots. These positions will create 2 new full-time on Graysdale's position control. We have a CS 27A at $58,994. Will assist with PCC computer programming, setup, and maintenance to ensure continued accuracy of electric health records, and will assist with compliance analysis surrounding electronic health records, resident care, and services. The second one is a medical records administrator, CS 26A at $56,341. Will assist with maintenance of medical records documentation, will assist with medical coding of required information for medical records, and will assist with records and documentation requests. And that was submitted by Mr. Dunlap. I think he is here tonight. And if he would like to come up and just talk about these. If my memory serves me well, I thought some of this might have been mentioned prior to tonight, that these positions were coming.
That's correct, yes.
Oh, good, okay.
They were mentioned, these 2 positions we've actually been thinking about for quite some time. And when to kind of bring them about. They weren't in the budget that were to take effect for 2021, mainly because of, the importance of these positions and assisting us currently. So we wanted to have the opportunity to have these positions posted and filled prior to the end of 2020. The medical records administrator is a duplicate of a position that we already currently have. This is just creating a second one. And this individual is responsible for ICD-10 coding of diagnoses, which is an integral part of MDS, as well as billing. They also they collect and maintain and go through the medical records that we currently have. They're in charge of archiving, storage, closing records within 30 days, as we have to by regulation after discharge. They also work with outside consultants and as well as the floors and the unit clerks to maintain. And as of right now, Graysdale only has 1 individual for every resident. And also they do work with prior residents as reviews and things like that come up with medical record requests. And we're essentially adding we'd like to add a second position because we only have one person for all the residents that we have at Graysdale in that regard. The informatics compliance nurse, this position is essentially a new position that we don't have at Graysdale right now. But if we really want to optimize our new electronic health record and also assist staff, this position would really be helpful in that regard, because what this person would be doing is making regular rounds on the units themselves, assisting staff, but also evaluating how they're using the current electronic health record system and ways that we can improve it. And then they would be deeply involved in implementing in the computer programming, as well as ensuring that it's functional for the facility and the staff to use. And the compliance aspect comes into this because, you know, the processes that take place within the electronic health record also need to make sure that they are up to date and in compliance with the standards of CMS, DOH, what have you. And the electronic health record essentially is the basis of everything we do, and it substantiates our compliance. And if it's not put within the electronic health record correctly and usable by our staff, essentially, if it's not there, it didn't happen in the eyes of the government. So that is what this person's main function would be.
Great. Does anybody, Mr. Hackman?
Both of these positions are 100% intergovernmental funded, right? Intergovernmental funds.
I'm sorry.
Reimbursed, what, 100%, correct?
Well, they would just be within our regular budget, because we have a fund balance. Yeah, I'm sorry if I'm not
Okay, I mean,
right. Yeah, no.
all right, yeah, I mean, I'm saying, even if we don't have fund balance, these are, you can get money back.
Oh, no, sorry, no.
That's what
yeah.
I thought. I just want to be clear. All right, thank you.
Mr. Myers?
You want to get these posted so you can fill it by January? Is that what you're asking us?
Correct, yeah, that's why they were not involved in the position request for the 2021 budget. We wanted to bring them forward so that we could try to hopefully get these positions filled quicker.
Mr. Kusick, did you have something?
Go ahead.
I have the nurse job description is not here, the informatics job description? Well, I don't have my email and I can't see it, so. What level of competent, is it an RN, an LPN?
It's an RN. It will be an RN. At least 1 year of experience with implementation and/or programming of a computer software or EMR, and 2 years of clinical nursing experience in long-term care.
So, do you think an RN's gonna really come in for that salary?
We do believe that this is an appropriate salary. I mean, based on what we're seeing, we believe that.
Okay.
And also, you know, kind of evaluating other salaries within Graysdale. But, I mean, we assume so, but I guess we'll see.
Well, I mean, I guess because they're not doing typical RN work, they will not be pulled to do so. They would be doing just the information
Correct.
side.
Administrative.
Correct, yeah. And similar positions, you know, in the compliance aspect, because we do have a compliance nurse that also works
Right.
with quality assurance.
Right. So
And
they would be
this-
in that department.
This pay grade is in line with those.
Okay, thank you for that clarification.
Is that all?
Yes, from me it is.
Mr. Myers?
Maybe I'm confused. This is not a part of the 21 budget, but you're adding this to the 20 budget? Is that what you're telling us?
It wasn't part of the new position requests that were within the 2021 budget, because essentially we would have to wait to post and fill these positions until after the new year. So they're being brought to council now so that we can have them posted and the positions filled prior to that.
Well, where's the money coming from for 20 for that position?
We do have money factored in.
There is money in the 2021 Graysdale budget to support these positions. We had reviewed that, and we had made contingency plans as these positions were being talked about. The timing of the electronic medical records and determining exactly if we would need an informatics nurse, we did not know as we're rolling that new software out that council was kind enough to let us purchase for the home.
I do remember some of the meetings where they mentioned some of these positions, but, so.
John.
Oh, I'm sorry, Mr. Kusick.
No,
Former council member, go ahead.
no, it just, I think every department head could probably make that exact same argument. I'd like to get this position filled now. you know, for me, when I see these requests come in November, December, January, I've always felt that this should be part of the budget process for next year. So you know, these sound like they are necessary, and I agree that getting coding right ensures that we're properly paid. But, you know, the process that we have here involves submitting these as part of the budget, and I wish it would have been done that way. Thank you.
Thank you. Any other questions? I think Ms. Zirinsky's also on the phone here.
I am on the phone.
Okay.
Thank you so much. And I do understand why the positions are being filled now and why they weren't in the 2021 budget. So thank you.
Okay. Okay, any other questions, any other comments? Thank you very much.
Thank you.
Motion to move positions to full council. No? Okay, so moved. Thank you. Okay, next up, we have a review of personnel requests for the Public Defender's Office. Brief,
That is not mine. Who's that?
That's mine, sorry.
We're gonna
Please
get to know
silence
people by their
your cell phones.
ringtones pretty soon.
okay, Northampton County Executive McClure, dear Executive McClure, this is to inform our request for an additional part-time public defender, assistant public defender position. With your authorization, this request will be presented to County Council at the Personnel Committee meeting. County Council currently utilizes contract attorneys to represent county residents who are subject to a mental health commitment out of county. The new position would eliminate the need for the considerable expense of the contract attorneys. It would also allow the Office of the Public Defender to concentrate legal representation in one attorney who would handle all mental health cases for our residents subject to mental health proceedings in surrounding counties. Designating one attorney to handle these matters also provides continuity of representation, which is critical to providing the very best legal services possible. It should also be recognized as an extreme cost-saving measure. Okay. New position is designated at, hello,
Hello.
0.5 FTE RS 6A with an annual salary of $25,774.50. And Mr. Luzio is here at the mic.
I am. Good afternoon, everybody.
Thank you.
Some of you may know this, but just by way of brief background, I started with the Public Defender's Office in 1998, and at the time, and for probably all of the time since then until I took my appointment in 2018, our office handles all mental health hearings, 303 commitments, 304 commitments, and that kind of thing. They traditionally have been held on Tuesdays and Thursdays mornings. It used to be that we rotated every couple of months, a new public defender would handle that particular rotation. When I came on board in 2018, I actually designated the new full-time public defender, Attorney Hydorn, who's here tonight. You will recall that you approved her position when I first came on board. She has, since I took my appointment, been designated as the mental health attorney. So she has primarily been handling mental health hearings on Tuesdays and Thursday mornings every week for the entire time she's been here. I would say about 3 or 4 months ago, I was approached by Chris Brubelo, who is the mental health coordinator. He's the one who schedules all the hearings. And he advised me, and I guess I didn't really know this, that if we have a Northampton County resident who is subject to a commitment in a different county, let's say in Bucks County, Northampton County, I believe through Human Services, handles those hearings through contract attorneys. And I was advised by Chris that on any given year, the county spends about $75,000, sometimes more than that, paying those contract attorneys. He asked, would I consider taking on the burden of handling those out-of-county hearings? And I said, well, I don't think I can do that with the staff that I have, but how about this? How about we take some of the money from the Human Services budget and designate a new part-time position, which essentially really is not part-time, but I'm told that that's how we would categorize it. And that particular attorney would handle all hearings. So Northampton County, Bucks, Berks, Philadelphia County, Montgomery, Pike, Carbon, and Monroe, okay? It's proposed that all of those hearings would take place on Tuesdays and Thursdays, probably about 3 hours each day. So if we pay someone a part-time salary of $26,000 a year, not only, as I said in my letter, do we have continuity of representation, but we're really saving an awful lot of money. So I said to Chris, that makes a lot of sense. Let me ask Steve Barron, can we do this? Steve said we can. And people who know more than I do fashioned this arrangement and designated the salary. And so here I am asking for the position.
Question, Mr. Heckman.
Mr. Luzio.
Hello.
The only question I have off the top is, the $75,000 is what we've been paying to the private subcontractor.
Approximately, yes.
And I know we use the subcontractors for many things, but part of the rationale for subcontractors is it would be cheaper than the county doing it itself. Are you going to be able to provide the same service at approximately $26,000 to $27,000 a year with a part-timer that we've been paying? I assume this is taking the place of the $75,000 subcontractor?
Right. And
Are we going to be able to do the same thing for that amount of money? Will this part-time
Yes,
person
I mean,
be able to do what the subcontractor is charging us 3 times that amount to do?
yes,
Okay.
yeah, I think so.
Mr.
I'm
Myers?
finished.
Oh, I'm
Thank you.
sorry.
Thank you.
Are you finished?
Yes, I'm finished.
Okay.
Well, I mean, I think what Chris Rubelo did for me is he worked up some statistics, and he advises me that year-to-date, we're handling, even including out-of-county commitments, about 5 hearings a week, sometimes more, sometimes less. So it's not as though every week we're going to have 5 Bucks County hearings and 10 Berks County hearings. It varies, and primarily it's going to be Northampton County cases. So yeah, I think the answer is yes to your question, especially now that we can do everything, well, we have been doing everything by phone. And at some point, we hope to, I guess, use the Polycom. I don't know why they haven't done that just yet, but I'm not involved in that decision-making. So yes, I think so, Mr. Heckman. I wouldn't be advocating for this position if I thought that it would lower the kind of service or reduce the kind of service that we're offering.
Don't get me wrong. I think actually I support it based on what you're telling me. I guess it just raises, sometimes when we have different things come up, part of our job is to think about how other things relate to it. And I'm just saying this in general, the argument, we have lots of contracts out there with all kinds of people. And generally it's, well, it's cheaper in the long run, or it's cheaper up front, or so on and so forth. And I'm going to support this. I don't have a problem with it. It's just that I think sometimes if things come up that point out that maybe we all have to, every department has to look at some of their contracts as to what we're paying, because we're going to be getting up a part-time person who we're going to be able to have do the work that we were paying a subcontractor $75,000 a year to do. And that just sort of, and I'm not picking on you.
No, I know.
Believe me,
I know.
you're a tiny speck when it comes to subcontractors. We've got some big heavy hitters in other areas with subcontractors. So it's an interesting. That just sort of stuck out to me when I saw, and when you said about 75,000, and we can do this hopefully with 26,000. I hope you're successful. So I mean, I have no problem with it. I know you.
If my memory serves me, I think that we have a certain number of contract attorneys who handle these kind of cases. Let's say, for example, 3 in Bucks County, maybe 2 in Berks County, who are being paid like $125 an hour, right? But historically, they've had to travel. And I think a lot of this has come about because we've gone to doing the hearings by phone. or they're doing them by Zoom, or will be doing them by Zoom. So it's more cost-effective to do it this way, because really someone just has to sit in their living room and handle the same kind of hearing that we would have traveled somewhere to handle. So I think that's a big part of it. And let me say, we would not be in a position to make this request and pay anyone, a paralegal even, $25,000 or $26,000 a year if they had to travel to Bucks County to do this kind of work. So we anticipate that this is going to remain a remote kind of hearing, and it really has to remain that way. Yeah, otherwise we'd be paying mileage and everything else. It wouldn't make any sense.
Okay, I better understand. Thank you.
Yeah, yeah.
Ms. Hefner?
Is the money coming from the human services budget? Or is it coming from her budget? Oh, she said that, he said, so.
So there's professional service money that resides in both budgets. We're going to keep in the 2021 budget the professional services money in the human services budget at this time. The person, when you create the position, it will be in the public defender's office. We will move the money when we do the human service budget amendment, the first one of the year. There will be enough money in the public defender's office to cover this. Now, if for some reason because this person is being hired just to fill that position, if we would need to go back to the contracted services, I would say keep the money in until we're going to amend it, but we're going to keep the money in human services, in the contracted services, in case we run into situations, because we're trying this process out right now. In the long run, we are going to have one attorney that handles all of these cases for these specific individuals, as opposed to somebody now, say, for example, you have a 302 hearing.
No, I understand the
you-
mechanism
okay.
of the position and what they're supposed to do. I'm asking about where the money's, because if she's
It's-
reducing the $75,000 pool of money, why isn't it just not coming from that?
It all comes from the general fund, and it ultimately will when we do the budget amendment. But this is, as Mr. Heckman would say, not a reimbursable expense because it comes through mental health. So it's a service that we kick money into, so there's not mental health matching dollars that go into this. Now, some of these companies do get money from the block grant. This is not one of them.
I don't know that that answered my question the way I asked.
If you're asking if the money's gonna come into the public defender's office, ultimately, yes.
Well, no,
I said
but
during
the
the
point is
first
she
budget
has the
amendment.
money, she's saying she has the money and she's spending the $75,000 for contracted. Or no, where does that money come
Human
from?
services.
That, this is all human service money to
Correct.
begin with?
Correct.
Thank you, that's the clarification.
Yeah, sorry, I didn't understand your question.
I thought it was from her budget and you were taking, these are the human services lawyers, but this is going to be a designated person through her for mental health. Got
To
it.
be clear, Ms. Hefner, one of the things that does happen, if it's a case completely, all Northampton County, straight through, person lives in Northampton County, hearings in Northampton County, the public defender's office handles it. So this is just also streamlining the process.
I got it, thank you.
Right, so you understand that then? I think you do, right?
Yes.
That we right now handle all Northampton County cases, now we'd just be adding the other counties. Okay, just so we're clear.
So I got a better understanding of this. You already have one full-timer in Ms. Hydethorn?
Yes, Ms. Hydorn.
So this half a person will be in addition to what she needs help for. Is that correct? Or they'll be able to assist her?
No, so Ms. Hydorn is full-time. That means she handles a full adult caseload, all adult criminal cases. But when she came on board, it was a condition of her employment that she also handle the mental health hearings. So she's, doing a lot. So this new position would only handle mental health hearings. So that would then come out of Ms. Hydorn's caseload.
In other words, she won't be doing it anymore. This person will just be designated for this.
That's right. That's right.
I don't have a problem with it.
Mr. Kuzic?
Yeah, I support the position. It makes sense. I guess my question, though, again, is this something that you could wait and start on January 1st? Or is there a need to get it immediately now, or is this just a matter of convenience?
If you want to keep spending $150 per attorney, we can wait till January 1st. We may as well start now.
Well, yeah, and I don't mean to,
Mr. Barron, nobody, the internet world didn't hear that statement.
I think that's awfully important.
If you want to wait.
Thank you.
And spend way more money now, we could get this done now, pay less money for the person, and have, give the people who have these mental health hearings dignity, and they have one point of contact and they see a familiar face when they're in these downtrodden times that they're facing.
If I could, Steve, I think, though, the root isn't the idea that we want to not give money. This has happened, and Mr. Kusick, I know that. Every administration, you want to use up some of the money in the budget, so you jam stuff through before the end of the year, which is fine. I don't really have a problem with it. I know John has always had a problem. I get, though, the thing. I don't think anybody has even suggested, though, that we don't want to have these poor people not get service. I think it comes down to, and you're the fiscal man, you want to use it and have it applied to this fiscal year as opposed to next fiscal year.
And if it is better, if it best, I always try to do, and the county executive always tells me to do what's in the best interest of the taxpayers. Honestly, if I thought that this was better served waiting till 2021 and going through the budget process and allowing it to exist in that vacuum, I absolutely would. I always consider that when people bring these requests to me. Believe me, the ideas that come to my desk that you don't even hear about, it's not every idea is a good idea. But this is one of those that we absolutely should do, regardless of the vacuum of the budget season we're in right now.
Just a comment. Thank you very much for explaining. Ms. DeLuzio, thank you for explaining. Mrs., I did say Mrs.
I did not.
I think the timing thing's impeccable too with COVID going on and being able to capitalize on in real time. And I think it's really a great idea to concentrate the legal representation. So, communication's important, and if you have one person focused on that, I think you lose a lot of time, just time, not just money, but time, subcontracting this and that out, so. Thank you very much. Does anybody else have anything else on this subject, or comments, questions? Okay, motion to move?
Move.
Thank you very much.
thank you, everyone.
Okay, and that concludes the personnel, unless anybody has anything else for the good of the order of personnel.
No, you have 4 contracts.
Oh, okay, hang on. Oh, I'm sorry, I didn't see that one. Oh, this is an important one, sorry about that, ask me.
They're all sitting there.
It's one little page, my apologies. Okay,
Agita.
well, I didn't finish, I did say for,
Agita.
just happens to be on the agenda tonight.
Agita.
Okay. We have a term sheet for ASME District Council 88, Local 1265, dated November 19th. And it is a term, extending the term for the 4-year CBAs until December 31st, 2022. For residual non-professional unit, court-related non-professional unit, court-appointed non-professional unit, and youth detention center unit. The wages effective January 1st, 2021, all covered employees shall receive a general wage increase of 2% on their 2020 base. Effective January 1st, 2022, all covered employees shall receive a step increase. Those at the top of the scale shall receive cash bonuses of $1,750, which shall not be included in their base. 911 supervisors shall be added to the residual unit, and those terms and conditions of employment from the residual unit CBA that are applicable to the 911 supervisors shall apply. Other than set forth above, there shall be no change or amendment to any of the terms of the 4 prior 2018-2020 collective bargaining agreements during the new term commencing on January 1st, 2021 and ending December 31st, 2020. Questions or comments? Mr. McClure?
I don't have any comments.
Okay.
Didn't happen yet.
Well,
I don't have any
I
comments.
almost slid right past that to adjournment. I
No, it's great.
apologize for that.
Thanks for picking that up. It's an,
I really apologize.
no, I don't apologize. It's, thanks for picking that up. It's important that these extensions get done and they get done soon. And I appreciate all the work that representatives of these units are here. And I appreciate all the work we did together to get this extension done in these very uncertain times.
Okay, all right. Okay, any questions? Oh, Mr. Kusick?
Just one, I think it's certainly a fair contract. My question has to do with the 911 supervisors. Typically, anybody in a supervisory role is not included in a bargaining unit. I guess my question is, why were those individuals added to the bargaining unit? And was that at their request?
It was. And, typically, my viewpoint, and you know this, you served with me here for many years, is, I believe passionately in the right to organize and the right to collectively bargain. And these folks wanted to do that, and I assented and agreed that they could join that bargaining unit. So we think it'll be good. I have to say, it is my view that AFSCME, these particular units that are in front of you tonight, and the AFSCME units that are represent our employees throughout the entire county, help us manage the county. I think our human resources staff would need to be 3 times the size that it currently is in order to manage a 2,200 person workforce. And AFSCME is critical in helping us work through all of the myriad issues that arise on a daily basis with our folks. So I couldn't be happier. And so when the 911 supervisors felt that they needed representation, I didn't hesitate to agree that they should be represented.
Yeah, and if I could just follow up, then I guess if somebody has a grievance about their supervisor, how is that going to be handled? Do you understand? Doesn't that create a potential issue?
They chose to join the collective, and they'll work that out amongst themselves, I'm sure.
Okay,
Okay,
I'm fine with that.
all right. Oh, Mr. Myers has
Just a
the
question.
floor.
Has this been ratified or voted on by the,
Yes, it has.
has it been agreed upon?
It has, yes.
Outstanding job, gentlemen and ladies.
Bill, I move we.
I'll move it forward.
Yeah, comment, I apologize for missing it on the agenda. It was right at the bottom there. My apologies to everybody that came out tonight, and
Can we,
we appreciate everything you do, ASME does.
Can we meet
I
them?
know the leaders are here.
You wanna
Can
come
they
up?
introduce themselves?
Sure, if you wouldn't
When they
mind.
came here, they could at least say hello.
Absolutely, thank you.
Thank you, Mr. McClure. David Parry, Vice President of 1265. Been a mechanic here for 5 years. Been in the union since I began, and I became an officer 2 years ago. So again, thank you, everybody, for listening to us and working with us, and we really do appreciate it. And we'll keep working to keep the county working. So
Thank you. We appreciate you too.
Thank you very much.
Dennis Henritzi, HVAC mechanic for the county, president of Local 1265, and keeping you guys comfortable in here is one of my jobs. Yeah, I know. We'd just like to thanks. We had a good meeting with the administration to work out the details of the contract or the contract extension that we got. Very generous, 2%, 4.5% increase for us. So we really do appreciate what you folks did, and thank you very much.
Thank you.
Thank you. Okay. All right, move? Motion to move.
So
Thank you. So moved. All right, we're going to try that adjournment thing again. Does anybody else have anything for the good of the order? Okay. Meeting is adjourned. Taking a break before we go to finance?
Do we have anything else? Linda, just finance and personnel? Oh, it's gonna be early night. Oh, man. Baselli struck again. The seal has struck again.
No, you're on your own. I'll be right back.
Made me sit here for 40 minutes.
So hopefully Jennifer got a kick out of me calling her Stephanie. Because I was talking, my assistant told her next time. I was like, and I said that.
Oh, there it is. Thank you. Wow, Kenny, that's dancing.
Thank you.
Pass one down.
I'll use it with pride. That's a good idea.
I know we're over, but you gotta watch it.
There you go.
Good luck.
Well, that was about
They gave you a pen contract. How many?
Yeah.
Yeah, she gave me a.
Yeah.
So that, I knew that.
Yeah, some of the contracts.
Yeah, I was originally. I can't really tell. Yeah. It's really hard because, he'll be the first.
Now tell us about the dirt at the stadium.
But
The dirt.
he'll be
So I didn't get to call you today because I was busy with other stuff. Okay. But that's what I think we should do. I told her just explain to me what you do.
When we did the hotel audit, we do that at the CUTs.
Just how you do that. There were a lot of maybe you should change your hands.
It's not like it's a county entity,
I don't know how familiar you are with the area, but other than like the.
In some hotels, we don't even know.
John, you know that's a time-honored
they
tradition.
don't have to tell us. No, it's
That's happened with us.
required by law, they have to have financial statements, we have to certify those. That's
That's right.
This is a rather unusual year.
What for what? He came up in the courthouse and with that mask on, the machine wouldn't work. COVID testing wouldn't work. Rover said. I started watching the game with Freem, I turned it off.
World War II.
On the check. The woman's like, I didn't know if it was like a major.
Tina Smith. Guess what?
I thought they were.
It's on Saturday.
Doesn't even look like.
Oh, that's.
Oh, they canceled it.
Always somebody trying to scam us.
I thought they just,
So one check was for $3,800.
Whoa.
Yeah, it was like 10 for $189.14. And what they did a mobile deposit. So what they did was they did mobile deposit at like 7, so right before the 8 o'clock cutoff. 189.14.
I was gonna say, because if you can't do mobile.
I just had to tell you that, of course, I did not watch.
And so they were under the $1,000.
Who's on the committee besides me, you, and Ron?
Or they were just, they were
I
under the
wasn't gonna say
$1,200
anything until.
in one day, but they did 10. And then what happened was that like $1,000 or whatever was available the next day. So they took it out on the 17th. They probably went and did a counter withdrawal. And then we get the check that we believe is fraudulent on the 18th. So they've had that money for 24 hours. The checks get returned to TD Bank tomorrow. So they have that money now for 48 hours. They just gave themselves like $1,000. So it's crazy.
What's the law with regard
Up, here he comes. All right.
We're not on the hook. But TD is on the hook for that. So they accepted the check.
Okay, we're going to begin the Finance Committee meeting. Thank you for indulging our break. Is there any courtesy of the floor? Seeing none, we'll move forward with the review of the controller's reports. Mr. Sabino is here this evening.
Good afternoon. Tony Basile sends his regrets. I'm here off the bench to do the reports that were released since the last Finance Committee. When we do 3 different kinds of reports. We do agreed upon procedure engagements, we do financial audits, and we do performance audits, and all 3 types of audits are represented in the stack that we have tonight. I'll go through them as quickly as possible, and if you have any questions, let me know. Our first one is one of the last hotel audits of the year is Town Place Suites, Bethlehem Easton. That's an agreed upon procedure engagement. And our only real concern there is that the amount of deficiency there is somewhat larger than normal, and it's because this particular entity changed hands and they missed a month. And so we caught that, and they have to pay interest and penalties on that. And other than that, that's what that one was about. Are there any questions about that engagement? Yes, Mr. Kiesel.
I guess my question is, who pays for it, the previous owner or the current one?
That's a good question, and I don't know the answer to it, other than that the entity, I believe, is on the hook for whatever the prior owners.
Wow.
Because again, it's not, you have to keep in mind, the hotel tax is not a tax that comes from the hotel. It comes from money that was charged to the people who stayed there. So it's money that is just passed through. So if they neglected to send it to us, it's not a matter of it's the old group that's on the hook. They still have it there, they just never remitted it to us. So this new entity has to take that amount of money and remit it to us. They're on the hook for the interest and penalties. That's basically just the economic value of the money, and that's so it's not a matter of them paying it out of pocket. It doesn't come out of their revenue, it comes out of the money that they charged to the people who stayed in the hotel. And they
Right, but if the previous management, does this make sense?
I understand, and I wanted to tell you for this particular hotel,
Yeah.
because they have reached out to our director of revenue.
Yes.
They have agreed to pay even a little bit of additional interest to pay it off over time. And we gave them a time schedule and a net payment they're going to pay for us. They apologized for the oversight, and they're gonna make it right, so.
No, I mean, that's
I
good,
know.
but, yeah, I mean, if I had, purchased or taken over this, I would have wanted to know that as part of the sale, like, when you
Yeah,
buy.
I would agree with you.
Yeah, so,
The hotels change hands pretty frequently, and we find that as an issue when we do these audits constantly, that the one group does not provide adequate training to the next group, and then we find the same problems. And that's why it's a good thing that we do these as often as we do them, and we sometimes get nuggets like this one where we find revenue for the county that's a little bit more sizable than some others.
no, thank you, we could use all the hotel tax we can get this
I
year.
want my resume, but I'm in charge of the meeting. Go ahead, Mr. McKee.
When this might help me for all of these reports, when you get the report, does the information come directly from the end user? Do you get the ledger book?
Yes, well,
To
what
get
we
their book
do
of
is,
business.
we do have 2 phases of this, where we get much of our information from Ms. Poplawski, the revenue manager. That's the money that she received and the reports that she received, and we spread all that on spreadsheets. And then we go to the hotels and look at, yes, that's when we look at their books and confirm that what they reported to us was accurate. And that's what ends up being the differences, because sometimes we find that what they reported was not accurate because they either included exemptions they shouldn't have included, or they didn't include pet revenue because they have to add, if you bring a pet, there's more money, they don't add that. So we look at all of that, and then we do an accounting of it all. And then that's when we find the discrepancies, and they're usually small. In this case, it was a little larger than normal.
Because the percentages are based on the price of the room, correct? It's not a
Well,
flat,
it is a flat 4%, but it's.
a
what is
flat 4% on the cost of the room.
On the cost of the room.
On the cost of the room,
But there
right.
is instances that are exemptable, and there are also components of that revenue that are more than just the room revenue, and sometimes the hotel owners get confused as what.
And
to
those are
include.
taxable as well.
Yes.
Okay.
What to
Thank-
include and what to exclude, and that's what we go out and try to determine and find.
Thank you for that.
And I have a question.
Yes.
Do you have a schedule that your office follows and how and when you're, because we obviously have so many entities
Yes.
within the county.
Yes.
So you have your own schedule that,
Yes, we do them in a 2-year rotation. So we do half of the hotels that exist out there in a given year and do a 2-year spread of that. So we're doing all of the years. And then the next year we'll do the rest of the hotels, and then we'll rotate again in 2022. So
But
we
if-
hit all of the hotels.
but if you have somebody who's in error, do you accelerate that or do you
Well,
just,
right now we're
do you keep track of the offenders or the chronic
Um,
offenders?
we certainly have a track of all of that, but anybody who is offending ends up having to pay interest and penalty from the moment that they messed up the records. So we will get whatever is owed us plus interest and penalties. So, and again, the ones that are offenders change from time to time because, as I said, the hotels change hands frequently. So it's not always constant.
I see. Okay, so I guess we'll move on to
Okay.
the magisterial district.
Yes, the
judges.
magisterial district judges, those
Oh,
are.
wait, I'm sorry, Mr. Myers, you
Okay,
had a
I'm sorry.
question? You want to double back?
Yeah, I just wanted, just so I'm correct, what was this before it became the Town Place Suites?
That is a very good question. I saw that on a spreadsheet today, and I cannot recall do you remember it was something
This is the one on
Nazareth?
248 across from the 248 diner, is that what we're talking about?
No, that one is,
Mike,
This is bizarre, Barry. That's good. Because I'm looking at it, it says 3800 East
this, what is the address?
3800 East Nazareth Highway.
Yes, so it's actually, if you remember where, so it's on 248. If you get off at 33 and 248, right where the shopping centers are, instead of going left to the shopping centers, you make a right. There's the car wash and the Wawa back there. The Town Place Suite sits back that way. I know it says Bethlehem, and that's deceiving. It is not in Bethlehem.
That's why I was somewhat confused. And the only other question I had, as we were looking at this, they actually filed 0 for 2019 in July?
In July, yes. That was.
How is that possible?
is that
It
the
is.
turnover month?
No, it's just that they missed that month because that was the month of the transition between the two entities.
Okay.
And they missed it. The new owner thought the other guys paid it, the other guys thought they paid it, and it just
Nobody paid it.
got missed, and nobody paid it, correct. And that's why I'm saying it's an amount that was on hand. They had charged it to the people who stayed there, so it's not coming out of the revenue. They just neglected to pass it through to us.
Okay, thank you.
Okay, the magisterial district judge, those are financial audits. The purpose of those are to certify the financial statements, each magisterial district judge has their own set of financial statements, and it is our job under law to certify those. They don't always have audit findings, and in this case, we have 2 of them that do and 2 of them that don't. Medj and Capobianco do not have actual audit findings with recommendations, but Zito and Schlegel did. They're fairly minor findings, and they're in there. I don't know if anybody has any questions about them. Zito and Schlegel, those are on the last 2 pages of the reports. And Zito and Schlegel had a couple of findings in there, one about regarding constables.
I'm the chairman.
Oh, Mr. Chairman, I'm sorry, I'm getting caught between these. But could Mr. Samir please just tell, without going through all of them, if it's just 2, if you could just summarize the
Sure.
2,
I'm sorry?
offices, what the exceptions were.
Okay, sure.
That way, you don't have to, I mean,
Absolutely.
So who were the two that?
It would be Zito and Schlegel, and I'll do Zito first.
Okay, thank you.
Okay, they're different.
Well,
They're by themselves.
Just say Mother Mayor.
They're on the last two pages. On Zito, that would be on pages 9 and 10 of the audit. In the case of Zito, there were some voids that were not properly approved by the magisterial district judge, so we look for that just for internal control purposes. There were some improper payments to the constables. There are some, the sheets were not properly filled out by the constables, and there was an overpayment to a constable. And there was also a finding with regard to constable server fees that was entered into the system and then for some reason was deleted with no explanation. We weren't able really to tie that one down because the person who did that was no longer working for the magisterial district judge by the time we went and did the audit. But these are all small amounts of money. Any questions on the one for Magistraate Judge Zito? Okay, I'll move on to Schlegel. That was on page 9, and with regard to the disbursements there were 13 canceled checks that did not include the authorized signature on the check signature line. Yes, I know the question usually is do the banks honor those, and indeed they do. So it's a technicality, it's a valid check, it just didn't get signed. And that was that finding.
Ms. Chairman.
Yes, sir.
I think I know the answer, but now these, especially the ones with the observation exceptions, that gets sent on to the judge.
To the judge and to the,
Judge Roscioli yet?
I'm sorry?
Who's the judge that is managing the?
Oh, Debbie French. Yeah, I'm sorry, no, the judge that is,
The common police, our judge.
president judge.
Yeah.
Yeah, it goes to the president judge.
Okay, I just want, yeah.
Yeah, these go to the president
I just
judge.
wanted to remember the flow when you do the,
And that it's addressed to, if you look at the first page, it's addressed to the county council, Mr. McClure and Honorable Corey.
oh, yeah. Okay. Why didn't I see Corey?
Because he's the president judge.
Yeah,
Goes
but
to
I
the
didn't see-
president
I didn't see
judge.
his name, I'm sorry. Yeah, yes. I was just looking down the line, I saw county controller, audit manager, solicitor, county executive, county counsel. I didn't see, you said it goes to him too, I just didn't see his name on here.
Yeah, it's not on the cover. We do not put those on the cover because this is a standard cover we use that just lists all of the elected officials that we normally deal with. But it's the address line on the first page, which is who the actual recipients of the report are.
So he always gets these,
Yes, he gets these, and we also send them to the state.
that's all.
Okay?
Okay.
Okay, moving on. The next one is an agreed-upon procedure engagement for our procurement card program. This one we did a little differently than we have done in the past because we have a software called ACL, which looks at 100% of transactions rather than a sample. So we use that for the first time on this program. And this audit generally exists so that we can give feedback to the procurement manager with regard to the entire amount of pre-card transactions that happened over a period of time. And when you see findings in here, they're not necessarily negative things. They're just the findings we found based on the procedures. That's what an agreed-upon procedure engagement is. I think the only thing in here that would have been of concern is there were some transactions where the receipts were not properly uploaded to the database that they're supposed to. Other than that, this was mostly just informational to the procurement manager. She was very happy with this report and uses this information. So I think it's a good partnership that we have with them on this project.
Any
Madam Chairman.
questions?
Did I miss something here? Because I have a magisterial John Capianco, are we not?
We skipped
Yeah,
those
those
two
two did
because
not
there
have
were
any findings.
no findings on 2, and we only did the ones that there were findings.
It's a lengthy report because there's a lot of letters in a financial audit that require to be filled out, plus you have the 2 pages of the actual financial statement. So if there's any questions on those, I can field them, but they're
That's
just
fine.
the ins and outs of the money.
All right, that's fine.
Okay?
So any questions on procurement
Procurement card.
card program?
No.
Under control.
Yes.
Offender supervision fee program.
Okay, offender supervision fee, that is a performance audit, and in those we have recommendations and a management response. And that was just a straightforward one. We do it every year, and in this case, they just have not updated their policies and procedures manual. And our response from the chief adult probation officer is that they intend to do that. So it's a pretty straightforward finding, recommendation, and response that we got from her. Any questions on that one? Okay, I'll move on to the last one, which is an audit I actually performed. So if you have any questions on this one, I can probably pretty much answer them pretty well. This one is another one of those audits that we use our software ACL on, which is, we look at the claims for a long period of time and every one of the claims. And in this case, it was over 230,000 lines of data, and we're able to analyze it in many different ways. And because of that, we usually end up having findings, and we have a few that I'll go through. We had some claims that were paid for ineligible individuals, and we do that by comparing the entire claim file to the eligibility list that the county maintains. And in this case, we had about 19,000, almost 20,000 of claims for ineligible individuals. Any questions on that particular finding? Or should I just move on to the next?
What happened in that case?
Well, what we try to do in these findings is we put cause and effect, and I think the cause here was it was errors on the part of the county where we had people who left, and we did not properly notify Capital Blue about that in a timely manner, and they paid claims beyond the termination date.
If I may, go ahead, go on.
Yeah, one thing that I noticed was retirees. I think there were a couple of cases where you had a retiree spouse.
Yeah, that's in a later one.
It's
but yes.
coming up later.
No, we can do that one next, because that's coming up next.
Okay, so I guess my question is, it seemed like there was nobody really particularly in charge there. Nobody became aware right away. Do you have any recommendations for what we can do so that?
With regard to that's the one with the Blue Journey, where we had somebody was, because that's a premium-based plan. So in that case, the amount of claims don't matter. It's the amount, because we don't pay the claims, we pay a premium. So if somebody is covered for a period of time and never has a claim, it's still on the county because we paid for those premiums over that period of time. So and this is the first time we took a really good look at Blue Journey. So we've added that, and so over time, when we do this every 3 years, we will be looking at that. But yes, the recommendation to Human Resources is that they should periodically review those eligibility lists. Now, one of the things that we do and have been doing for a number of years is we use that ACL software every 6 months for the Human Resources Office. And instead of doing a big audit, we just take the eligibility list from Blue Cross and we compare it using that software with whatever the county says. And I give them a memo saying, hey, these are all the people that are on one and not the other, and they review them. So we're going to include that now going forward.
Okay.
So every 6 months, we'll look at that. And this has been a very good partnership between us and the HR department. They are very, very cooperative, and I think because I've done these now about 5 times, and each time it's gotten better. The first few that we did were really, really poor.
Oh, I remember. I was here. There were some ugly ones.
Yeah, so this one is and because of that partnership and their commitment to correcting these, it's a good process. So in answer to your question, we will continue to look at that on a more ongoing basis, as will HR. Okay?
Go ahead, Mr.
Going back to your original, that just
Yes.
in general, people leaving, and it's not being picked up for Blue Cross. This is something that seems to have been going, I don't know, I guess your audit is as much performance as it is fiscal. The county over the years has had problems with catching people sometimes. And you, and as you mentioned, you've been here and you've done these, where would you say we're at now? I mean, are we checking enough, whether it's a monthly basis? Because we always seem to have a few people slip through.
That is true.
Employees with Blue Cross Blue Shield. And I just wonder, is there a procedure we're not using that you would recommend? Is it a software issue? What is it from your perspective?
Well, from my perspective, is Kathleen still here? Can you address that at all with regard to, because again, it's on HR on a daily basis to make sure
But
that
you've
the.
worked with numerous HR departments. When I say HR
Absolutely.
departments, I talk administration.
Absolutely. And
So I mean, and I'm not saying now it's worse than it was. It could be much better than it was, but it seems to have been a continuing issue. And maybe it's just the nature of the beast. If you have as the executive mentioned, we have 2,200 employees. I mean, we're one of the largest employers around. So if that's the case, then so be it. I mean, maybe there's no way around it.
also
We're
have to
within a
state that
margin there, but I would
part of
just
the issue
like
is
your
that-
perspective based on your experience.
Sure, and part of the, I would have to say that part of the problem is going to always be, in this audit, we're looking at 100% of the claims over a long period of time, and in other audits, we will pick a sample. So in a situation like this, it is much more likely that we're going to catch errors than in some other audits that we do. And I would have to say that because of the large volume of transactions and the large number of back and forth information that passes back and forth, that there probably will always be a small number, and our goal is to minimize it as much as possible. And I wanted, if Kathleen could address that, what HR does on an ongoing basis to make sure that these roles are clean,
Yes.
so that claims do not get improperly
All right.
claimed.
Yeah, and Kathleen, I'm saying that in terms too of the fact that since we're self-insured, whenever this happens, it's an expense, on the county. So that was part of my concern.
Yep, so what I can tell you is when this administration came in 2018, we were made aware of some processes that could be improved and, put some procedures in place to make sure that we were checking specifically the Blue Journey enrollments monthly, working with the controller's office to put in semi-annual audits so that we can check these for data entry errors, more regularly. My staff is in charge of entering all changes for 2,200, for all of our, 2,000 employees manually. And when benefits changes occur, that requires us to go into 7 different portals. So, we're working on attention to detail and making sure that all of that data is entered accurately. There's different times throughout the year where it's, a busy office, people are coming and going. So we're just making sure that, we're really paying attention to what we're doing. And if we do find an error, which, we're reviewing each other's work and, putting procedures in place to be able to catch those
So
as
if
quick as
somebody
possible.
leaves, or if somebody's son or daughter is off, is it the employee's job to let you know, or to report to their immediate supervisor wherever they work? I guess I'm trying to follow it. We're a large and complicated organization, so this isn't about somebody who's doing something right or wrong. It's just, I like to keep up to snuff on personnel because we're big on personnel. So the guidelines would be the individual, something changes, if they quit or they're just told go home, don't come back. You enter that in that they're not getting paid, their date was such and such.
So we
Now, I
do-
realize for healthcare, they go to the end of the calendar month. So would someone then be entering, is there someone specifically responsible to do the healthcare, or is that just shared?
Yeah, so we do have someone that specifically works on healthcare here at the courthouse for the majority of the county. And then we also have one individual in the Graysdale Human Resources
Yes.
Office that's in charge of Graysdale. But yeah, we do enter that information and we rely on employees and supervisors throughout the county to provide us that information. So sometimes there are times where we don't always get that in a timely manner, and we're kind of working backwards to try to get that information entered. And that's where you could sometimes see, where we paid for somebody that should have been terminated, a claim for somebody that should have been terminated, but they accidentally remained on the plan for an additional month because the termination date wasn't delivered.
Right, and I understand. I mean, and that's part of the problem. It's not all about you because you rely, this has always been the case, you rely on, for example, supervisors, directors in certain areas or division heads. And if they're not getting the information to you on a timely basis, you can't process it. And I guess I wondered if there was I guess there's no way to double check on that until, I mean, you're just not going to know. I mean,
yeah.
I don't know if it can be cross-referenced with, maybe it doesn't happen often enough to worry about it, but I don't know if it can be cross-referenced against pays not going out or something.
I think what we do now is when we see these things happen from, different departments or supervisors, we make sure to educate and let them know that we need that information in a timely manner and try to fix the problem moving forward.
Okay.
So that has certainly helped, be
right.
able to enter that,
All right, thank you.
more timely.
Go ahead, Mr. McGee.
Real quick, while you're there, is there a reconciliation sheet or is there an actual county form that each department head is required to send to Human Resources when there's a term?
Yep, so we have a personnel action notification
Okay.
form, a PAN you've probably heard. And for every change that happens in the county, so new hire, transfer, termination, resignation, leave of absence, we get those forms we're supposed to get those forms for, any type of employment action.
So they do come in from the department heads?
They do, yeah.
Okay, and then at that time, is it a weekly process that they go into, like the E-GEMs with Capital Blue and update it? Or is it a monthly process? Or
Depends on the situation.
Okay, so they-
Weekly, monthly, sometime, there's some data that we can enter right away into
Okay,
Capital
right,
Blue.
right.
But we also have our employee information system that information has to get entered into too. And sometimes the information can be entered in one system on week 1, but in week 2, it can be entered in Capital, just depending on the timing of these things that are happening.
And then you have the dependents too that are also ancillary to all the participants. Okay,
Yep.
thanks.
So when I look over this, it looks like most of these can either fall in the category of like a COBRA mishap or just a reporting mishap from what it looks like. But there's some that are real, like how do you ask to collect the money back? Like in the one case where someone was deceased and it was just missed for so long. Does the person who had the faulty claims, are they liable to pay that back to the county or?
So in most situations, we look at every case and it is taxpayer dollars. So typically we would request a refund. In that particular situation, the person was not offered COBRA when they should have been. So that was a county error and that went back, I think, 8 years?
Yeah.
I believe. So
wow.
we did she remained on the plan. So then we did offer her COBRA and, made it right at that point when we found out of that
So
error.
we're not heartless.
No.
That's good to, but it looks like it's a case of somebody not catching the COBRA or not, because obviously, I was gonna ask, but it says here, if there's someone who dies, are their spouse or children, if they're covered up to a certain age, eligible for that? And they are, as long as they opt for the COBRA and make those COBRA payments, correct?
Yes, and we do have we get a Berwyn report for retirement, we get notification of death, so we have a process to, move forward and offer them COBRA. The other thing is, we used to do COBRA in-house, and that's something that you don't want the responsibility for, so we do have a vendor now that takes care of that, so a lot of the COBRA things that you've seen were previous to, I believe, 2018 when we signed a new vendor.
Okay. And then what about the couple that cross-claimed each other?
Yep, so they were both retirees and both eligible for, to be on their own plans, but they shouldn't have been dependents on each other's plan. Luckily, it was 15 to 20 years, there was only one claim of $69 that was filed for both of them. And we don't have any instances that we're aware of at this time of anybody else that of that situation happening, so.
And I have to say that in nowhere in this particular audit did we find any indication of intentional fraud. We have had in the past found intentional fraud here, which we've gone after and recovered. Plus, it's usually a policy, if we find that the error is on Blue Cross's part, they always make us whole.
Oh,
because
that's good to
They've
know.
always done that. But in this case, I think all of the errors we have here on the county, so it's on us to decide whether or not we want to go after the individual or eat it. And that's, I think, in this case, what would be going on with most of these. Okay?
And what about the bottom? They said you find similar findings in the audits of dental and vision as well, which aren't listed here. You just listed the blues, so.
Well, that was just the contractual, I believe you're referring to.
The last page?
The last page. Yeah, we have a situation where we are now getting these contracts through the LVBCH, which is the Lehigh Valley, I'm not sure what all that stands for. There you go, on healthcare. So we are getting these contracts and we're using a format that unfortunately administrative code says that all contracts have to have certain language in them that are county contracts, and this one did not. And we have recently, over the last number of years, done an audit of dental and vision, and the same finding was in each of those. They've corrected those with addendums, and that's what we're recommending here, is that this one also doesn't have the wording that complies with the administrative code. So we're recommending that they do an addendum on this contract, just to make it all in compliance with your code, so. Okay.
Any other questions regarding this? Nope. Thank you so much for your time.
Thank you for having me. Have a good evening.
Okay, review of 2020 budget amendments.
Good afternoon, council. Your last council meeting, you entered or read into the record the ordinance for consideration Thursday, tomorrow night at your meeting. This is just a detailed breakdown of the budget amendment. Most of it is just housekeeping, but I'll give you just a list of why. Pretty much everything but human services. Human services is actually the standard human service amendments, and you'll notice there are a lot of numbers that begin with 4 on it. Those numbers are just the projections of revenue that are coming in. So as the state gives us our revenue and the timing of that revenue that comes in from the state, we had made those adjustments accordingly. So that is the year-end housekeeping that we normally do. And there will be, beginning of the year housekeeping with your first amendment of 2021, just to kind of give you a highlight of that. The top line, the solicitor's office, you'll see there's a change to salary and fringe benefits. Remember, when we put salary and fringe benefits in the smaller offices at times, the estimates for those offices, there might be a little bit higher expense that outpaces the estimates. In this case, we needed to put $5,000 into that budget. The budget itself stands alone, so there's nowhere to borrow that from. Most times you don't even see that, and as we're looking at year end, we make movement in a budget. So you'll never see something like this and say the Director of Administration or Fiscal Affairs, but because the Solicitor's Office is a standalone budget, we had to make that adjustment. Community Economic Development grants, you'll notice there were 3 additional grant awards. I believe DCED talked about that at their budget hearing. We got those awards. They are in the budget now for 2020, and they will continue through to 2021. The Conservation District, we also have grant revenue adjustments there, which we talked about at your budget hearing. Under administration for conduct of elections, we have the GEMS money. We got it for 2020, so it is now in the budget. Administration task force and equipment, that is an estimate for the rest of the year. Along with the Northeast Task Force, we're getting more money there, as you'll see. There are 2 additional counties that are now part of our task force, Wayne and Luzerne County. Their task forces were dissolved, and now the Northeast Regional Task Force handles them. So the increases in expenses are for that equipment that comes in and paid for out of those grant monies we just received.
What counties were they?
Wayne and Luzerne. We have the Northeast Terrorism Task Force is housed here in Northampton County. We house them. We handle all their budget. The Northeast Terrorism Task Force can't own anything. So they basically, their employees are 1099 employees. We administer their grants and their financing for them, and then we pay them out of those grant fees, their 1099s. We write them a check.
But who else, what are the total, who are all the counties in the Northeast? You said you added Wayne and Luzerne, but who else?
It's Northampton, Lehigh, who are the others, Todd? Bucks?
Northampton, Lehigh, Carbon, Monroe, Pike, Wayne.
Luzerne?
Yeah, you just added Luzerne.
It's added Wyoming, so
Yeah.
there's a total of 10. I'm sure I might have missed.
What's the one above it? Oh, you said Monroe.
Yes, Monroe, Wayne, Pike.
Carbon. Okay.
And they were added in. Their task force that they were in dissolved, so the state moved them to us.
We have to get a clip on or pass around.
Their task force that Luzerne and Wyoming were in was dissolved, and our task force took those two counties, Wayne and Wyoming and Luzerne. The other ones that were in that task force that dissolved went over to other, like South Central and.
And Lackawanna's not part of ours?
Lackawanna's part of ours. Yep.
Thanks.
Come on.
That's an inquiring minds want to know question, I guess. Sorry. Good.
Um,
On the coroner.
And in the corner, it's professional services. There's some COVID money going in there, along with utilities for the new building, because we are in there. So to make that whole for 2020, and then the utilities are in the budget for 2021. I think the part I not unintentionally glanced over, but it's important, the balancing number from the fund balance goes down because of this. As you know, in our budgets, we do take a hard look, but we're very fiscally responsible with regard to our revenue projections. And when we do get this additional grant money, we are able to balance, lower that number, $1.4 million. And that is the budget amendment. Any questions?
Questions? Okay. Thank you. Next is the review of Monroe County local share accounts funds for the coroner's office. Is that you?
Yes, we need a resolution from county council. We get, from the horse racing, we get, we are eligible to get the Monroe County local share money, for the new forensic center. We would like to use that money to purchase an x-ray machine. And we need a council resolution approving us to ask for said money.
So do we need a motion to move this forward?
So moved.
Thank you. Review of an allocation of CARES Act funding to the Greater Lehigh Valley United Way for the Mask Up LV campaign.
Good evening. I wanted to take a minute, if I may, to introduce Miss Erin Connolly, who is here representing the Greater United Way, to just give a little brief overview of exactly what that program entails.
Great. Excuse me. Thank you, Tina, and thank you all for considering this request. So really, this is a collaborative effort to have a regional aligned public health messaging campaign. So we know with COVID cases increasing, we know individual organizations were putting out messaging about masking up. But we, as a strategic response team, which is a team that formed in the early days of COVID, to have an aligned and collaborative approach to response and recovery from COVID. It includes the health networks, Northampton County, funders, nonprofits. We knew we couldn't do this work alone, and so we attempted to de-silo, bring our sectors together, and figure out how we could get out in front of some of the issues that were coming up. So a number of projects came out of this, and Mask Up LV is one of those. So the goal is to have trusted messengers. So these are community leaders, people from Allentown, Bethlehem, and Easton to be able to, we'll have short PSAs that not only will the group that's involved in the strategic response team all collaboratively share over social media, we'll also have a number of ad buys so that these are PSAs that can play before, news clips play. We can approach Lehigh Valley Public Media about playing it as well. So we have a social media campaign and then a digital media campaign, all centered around masking up. The content will be in English and Spanish. And we are ready to go. We have a production company ready. We have a social media company ready. And then we have our in-house communications team who's really experienced at ad buys as well. So we are ready to hit the ground running. We are also approaching both the health bureaus and both the counties for $6,000 each to contribute to this joint campaign.
Okay, any questions?
I have a question.
You just want to be on the campaign. You should be.
I guess.
We're looking for
You've been talking
participants,
masks
though.
since this started.
Well, that actually ties into my first question, which is, I mean, I think it's fine, $6,000, I support it. Are we at a point, though, because I had this conversation with a few leaders, are we at a point where doing a mask-up campaign is really going to be that effective? I mean, if people haven't gotten the whole idea or concept of a global pandemic by now, I don't know what more you can do to get them to put a mask on.
Yeah, I mean, that's a great and fair question. I do think that doesn't negate the need to keep on pounding home the message, right? Sometimes they say you need to hear something 7 times. At this point, it'll probably be 17,000 times because that is a message that has been going out. We also know that the organizations that are involved in the strategic response team, again, we've all been doing our individual messaging. So the opportunity to really align around a common message and a common content means that the message can go and the content can go a lot wider than we all can do individually. So I agree. It's, people who maybe not hearing the message, it's tough to get to them, but we sure as heck want to try.
And I do think that the bilingual part of it is probably a very good idea. The only question, and this may not be for you, it may be for Tina, I just want to understand the resolution. I'm looking here at the number 1, number 2, number 3, small businesses grants, and I know some of this is just verbiage we put on everything because it covers everything. And when we do a resolution, we throw words against the wall. But I guess the question I'm wondering is, following costs related to assisting businesses with COVID-19 disaster emergency, which I agree with, certified economic development organizations, local development districts, industrial resource centers, small business development centers, and economic development corporations. So what does that mean? I mean, are we giving money to Donnie Cunningham's group, or
No,
because Lord knows they
no,
don't need
it just explains what we've done in the past and
Oh,
what the eligible expenses for the whole bucket of the 27 million can go to.
So I just wanted to be clear, so that's
No,
just
no
all
more
preface
money
to the
for that.
way.
Same preface.
Okay, thank you, that's cool. I'm okay.
No questions?
Motion to recommend full approval.
Thank you. So moved. Review of CARES Act funding for small business grants. Thank you, Erin.
Thank you, Erin. So, working with our administration, we'd like to propose to council with the remainder of our CARES Act budget in the amount of $1.3 million for an additional round of small business grants.
You got 1.3 you can disperse?
We do. And if they're all fully funded at the amount of $15,000, we can help 87 more businesses in the county.
So at this point, you don't have a list of,
No, in fairness, we would need to open it back up for a very short period of time. We would look to do a hurry-up press announcement on Friday, open it up immediately, give a 2-week turnaround period, flip them and be able to get the checks out so they can be distributed in cash by the end of December.
questions?
Mr. Barron.
Yes,
Is this
Mr.
going to be
Myers.
a problem getting this out and done? Are we going to go through the chamber to do this, or how are you going to handle it yourself?
So the chamber will actually, they already have the infrastructure built. They're just gonna flip the switch back on. They will give us all the information, and then from there, the Department of Fiscal Affairs does the rest of the work. We have the letters already done, we have the checks that are able to be printed, and we have the process.
So, if I may, Steve, so we want us to vote on this tomorrow, but then you'll give us the list of everybody by the second meeting in December?
Yes, so you'll have it, so your meeting schedule is quick. So the way I envision this happening is, we get it out for Friday, we give it the 2-week process. I don't know that we'll have it for your first meeting in December, but we will have it for the second. And that is the last meeting where we'll tie up all the loose ends for the year. I'll be able to have that done. Those checks will then be printed the next week and done in the next week's check run, and they will be in the mail and arriving the week of Christmas.
Well, that would be a nice Christmas present for some of these people.
So this is all the money?
Well,
left.
there's another resolution that is next on your agenda that I will talk about, but yes.
Okay, so the only thing, and I think I mentioned it, I might have mentioned them a time or two ago, the Saucon Valley Community Center, I don't know where they fall, if they're like they're a mental health organization, if they're a business, but they have been kind of in the gap of all this funding.
Council contingency, if you want.
Yeah, and I know they've been
But I'm wondering if
covered in-
they're eligible because of what they do for any of this COVID money.
yeah,
That's what I'm
exactly.
looking, I don't mind the contingency, but I'm concerned about that.
I don't think that they're not going to qualify for this because they're not a small business. That's a nonprofit.
Yeah, so, I mean, if they reach out to Tina, and they have have them reach out to Tina,
Wait.
and then we can,
Can we put them, because I did mention for them to call you and ask if there were other grants or other places that I'm not thinking of, because I know they don't fit in mental health, but I think they do with aging, and I don't know if there was any aging money under COVID or childcare money under COVID that they would qualify for, because I think they serve those two populations. Saucon Valley Community Center.
No, because it went to drug and alcohol and mental health.
it did,
The
but.
the COVID money for human services would not fit one of those categories either.
All right, well, can I put them in contact with you because even if there were funds for PPE products or whatever, if we could try to
We did have
help
that
them.
earlier with Grow Norco.
So you're going to press conference this on Friday and get it out?
Yes.
But I think we need to move it forward to tomorrow if we so choose. Ron? Thank you. I guess we're getting a presentation, folks, on the Review CARE Act funding for purchasing equipment for the county buildings.
Steve has a whole Skynet presentation, I think.
Skynet?
Yeah.
It looks like the thing
Tell
from
us about your-
Giant. What's
Tell
that
us
thing
about
from
your
Giant?
robot, your
Robbie the
intelligent
robot?
robots you're buying.
Oh, jeez.
I think,
Okay.
let's see, make sure you don't steal.
So,
AI.
so you can blame Mr. Dunlap for the robot.
I have no signal.
Is it,
No, no signal.
It's there, but it's not here, which is the whole purpose of
what's
having
that?
this.
It's
It's
trying.
up there, but it's not on our
It,
side.
it may take a second to loop in.
You may want to hook one of those robots up to our electronic system.
Let me-
Council.
How about now? Because I just advanced the slide and went back.
Blank, it's blank.
Turn your monitor off and turn it back on.
How do we do that?
I don't think we can,
I don't think
can
we
we?
can.
No, I believe there's a power button on the side.
We didn't get orientation on that, Steve.
Sorry. The computer's been off and I just turned it back on, that's why.
Where's
Put it
the,
out of the way.
Button 3 times.
oh my God, I'm breaking the whole world here. Thank you.
This isn't a good start to spending millions.
Sorry.
It's the top one.
Okay.
Nope. It's like my other computer, nothing.
All right. Let me
Oh,
see
no
it.
signal, I'm alive.
Hold on. You should be able to see my computer screen if it's up. Let me do
Come on,
this.
Tom, you're gonna have to walk down
Hold
the
on.
aisle.
Hold
Yeah, I
on.
mean,
I plugged it back into the monitor, so let's see if that refreshes it. Yeah. It'll find me in a second.
Quality control issue.
Might come up now.
Hey.
All right.
I'm giant like the robo.
All right.
How's that?
Sure.
Much better.
All right. So, in the resolution, to give council, you guys have been asking each meeting how much money we have left. So we do have $1.9 million left. Now, some of the stuff we are going to be purchasing is related to cleaning and helping us to maintain social distance in the building and in our facilities. So one of the things we are purchasing for Mr. Myers and Mr. Heckman, you will remember the old things that would drop out of the ceiling in a gym that would divide the gym up. We are doing that at the jail. So that we are able to maintain social distancing while allowing the inmates to do things like that at the jail and to be in the gym. So we're doing a lot of those types of things that are listed in the resolution. However, there is some technology and there is some UV disinfecting that we are going to be purchasing. We have had the situation of having some employees who work in the building contracting COVID. Now, we've maintained social distancing, worn our masks, but it got Tina, the county executive, and myself all thinking, what can we do to help with the cleaning of the building? And Mr. Dunlap at Graysdale, through a county cooperative, purchased these Libots. Solaris makes them, they're available through Medline. And we are going to purchase, if you will allow us to, 10 of them. They do not, we jokingly say they look like Rosie from the Jetsons, but these robots actually go into a room. They have a UV pulse that is attracted, that they emit, and it actually cleans MRSA, SARS, the influenza vaccine, the influenza virus, as well as COVID-19. It is very effective. Hospitals use them. I have some videos to show you how it works and how the machine actually operates. So that is actually slide 3. So you should see it. I want to make sure I'm not going to blow you away with the volume. This video is pretty loud. So. So now that robot actually is wheeled into a room. It goes on a 3 or 5 minute cycle. You can move it to multiple areas of the room. So as an O&M person cleans an office area, they move the Libot into that area, and the UV light actually will sanitize the room and sections of the room. This will be particularly helpful in cleaning our buildings and making sure that the employees and the public at large that come into our public spaces are safe.
So it's wheeled in, Steve?
It is, yes.
It doesn't self, because I mean, I feel you have people out of Graysdale who are getting on in years, and they wake up and this thing's like cruising.
No,
next to 'em.
and actually, if you will indulge me for a second, I want to show you, I wanted to find a video of this device actually working. And there is a news report that I did find that will actually show the device working. So hold on, I gotta close the slideshow.
Oh, no, I just want to be, come on. Can you imagine waking up and seeing that thing? Well.
Okay, now you can see my screen.
No, yeah, hopefully it's not as creepy as the the robot and the giant.
We could put big eyes in the back of the orange head, if you like.
No, that thing sneaks up on you in the giant. I don't like that at all.
Let me see if this is
All right.
spinning wheel of death here.
This is serious, Steve. We know.
Oh, I know. Hold on.
Home soap, that's right.
That's the second part of the presentation. So they're gonna be, we're gonna buy a bunch of them. They're gonna be on different floors. They can be wheeled easily into an elevator, up and down an elevator if need be. If we know there's a specific area, that, needs cleaning more than another, we will, maybe deploy 2 of them into a certain area, use it for not just the 5-minute cycle, but in different locations, multiple 5-minute cycles. The O&M staff will be trained how to use them. It'll be part of their cleaning regimen.
How many buildings do we have?
A few. We're anticipating purchasing 10 of these devices.
Are they easily transported if we
Yes,
take them?
yes. Here you can actually see the robot. This is a video I wanted to show. There's going to be a commercial. I apologize. Maybe there won't be. It was.
While this is waiting, how much does each unit cost?
Thank you.
Brian, do you remember the cost? I know I had a price, and then we got it lower as we were going to be purchasing in bulk in Moss.
The one that Graysdale purchased was $55,000 for the machine itself, and then it's $30,000 for a maintenance contract. But the maintenance contract, if I'm remembering correctly, spans 3 years. The bulb in it is a xenon bulb. The maintenance contracts include all bulb replacements over that time as well, because the bulbs can be expensive if you purchase them outright.
And just so I apologize the video is not working. That's why I have handout materials for you on your desk.
So we're looking at the second thing?
You're you're still looking at the first one. So the robot itself actually emits a flashing light, and that's why I was going to warn anybody who might have a seizure disorder to look away from the screen. But folks can't be in the room when these go off. There's a delay setting. And the xenon bulbs that emit this UV light, both devices we're going to be talking about have those bulbs. And in the 3-year service agreement, that service agreement covers the bulbs.
Steve?
Yes.
I mean, we've chatted over time on some of this. I'm not, I don't make light of it. I'm not making, I think anything that can help, and I know I'd ask you about longevity and when we're out of this, and I can see, we're also concerned about the future. I guess the question I would have is, and this may go to you or someone else, but the thing is, anytime there's a situation in the world or in life, it also presents opportunities. We are an entrepreneurial species. And so somebody says, epidemic, I'm going to create this, which I'm going to sell as killing all these germs. Has there been tests of these? I mean, how long have these things been in existence?
So the Solaris machine has been in existence now for a couple of years. They're actually sold by Medline, and the video I was going to show you, they use them in a hospital setting. They have been clinically tested and proven. We're not doing anything fly by night. These folks are on state contracts, and they've been competitively bid in that regard.
Okay, I think you have do you want to say something?
Yeah, the UV technology as a whole has been used in healthcare for some time, so it has been proven. Previously, you saw it more in like acute care and in hospitals, but now obviously as COVID-19 has inundated our communities and long-term care facilities, they are starting to come out into those markets as well. So they do have a history and they have proven themselves. One thing I just wanted to touch on, because I know some of you had like some safety concerns. The machine, like Mr. Barron had said, does need to be in a room by itself. And there are safety mechanisms on the back of the unit. There is actually a little screen where passwords and codes need to be put in before the machine itself will even activate. And there is a time to allow people to get out of the room that are programming the machine at the time. There is also a little sign that, the best I can describe it is, it looks like a wet floor sign essentially, that goes outside of the room after the door is closed. Within that wet floor sign, it has a sensor that communicates with the machine itself inside the room through Bluetooth. And should that beam break by somebody accidentally going into the room, the machine shuts itself down automatically, so there is no UV exposure.
If I may, Madam Chairman, just to follow up on that. But how are we gonna, this would be used, you said earlier about a resident room. I mean, so you're gonna have to yank them out if you wanna use this in a resident room.
Well, how we're currently
How
using,
long is the cycle that it runs to do that?
it's 5 minutes, but depending on the size of the room, you may have to move it to different quadrants in order to cover the entire room.
Okay.
Now, we're not using it in rooms that are currently occupied by residents. What we're doing is on our Tower 10 unit, which, as you know, is designated as our COVID unit,
Right.
we're using it to sanitize that area and rooms as, residents return back to their regular rooms to completely disinfect a room before someone else potentially goes into it. As well as we've also been using it in a rotational basis in some rooms that may not be occupied right now. We're also using it on off hours to sanitize office space, nursing office space, our clinic rooms that residents occupy every now and then. And also our future use, even past, COVID, is, as we may see cases of infectious diseases pop up, we will use these in those rooms where a resident may have been in order to ensure that it has a higher level of sanitation before somebody else would occupy that room.
All right, thank you. Thank you.
Any other questions, Mr. Myers?
Okay. You can come on back up, because I'm going to quiz you.
This is like a whole new world for you, right?
Yeah, I'm really intrigued with this. So, all seriousness, this thing, it's got safeguards.
Correct.
All right, and you're telling me because it's using some sort of ultraviolet light that's going to go in there, we can lock that room out so no one can get in it, correct?
Correct, yes, and that's what we do.
That's what we'll be doing with that. Has anything been discussed with you, because I know the last time we were talking about budget, I had mentioned a spray gun that's used to also do that. It's
Right.
electrostatic.
Yes.
So we have looked at the electrostatic stuff. I specifically did research on it, and it was brought up to Ms. Wondolowski. The problem with the electrostatic one is that you need to have a completely clear surface to do that, because it does take papers and leave a residual on the paper. So if somebody leaves a paper on their desk, it's important. There has been issues with that crinkling paper and things like that. So that's why we went the UV light route.
I used a gun that was electrostatic, and we didn't have that effect. And you went around, we used paper, we hit uniforms, we hit locker rooms, we hit the whole 9 yards to that particular instrument. I mean, there might be an issue with some of it, but, okay. That might be an also good backup in some situations, because that, you're done. Once you spray, it's done, and you can get your people back in there. What's the timeline on the actual light doing its business, and we can put somebody back in that room?
It's immediate.
Yeah, it's instantaneous. Once the cycle runs, the surface is sanitized.
So we're talking about 10 minutes?
Correct.
Put somebody back in there?
Correct.
Now, my question to you or whoever's going to be in charge, if we have a hit, say at DHS, someone gets COVID, and we need to hit that night, we can get those machines in there and...
Absolutely. There's going to be a machine over there.
So
And anywhere else we might need to have it done.
24/7 operation.
Who's going to run these machines?
That
I'm
was
cutting
my
on your
next
time,
question.
but
The O&M folks are going to be trained on them within this building. I don't know who uses it at Graysdale. Mr. Dunlap could elaborate on that. The one situation, the reason I also like the UV is because at the jail, if you're sanitizing certain areas, COVID isn't just the only thing. You have your influenza, you have SARS, you have MRSA. Those are the types of things that, we can also sanitize those areas as well.
are they programmable or reprogrammable?
They have a 3 and a 5 minute cycle on them, so it depends on the area you're looking to clean, but yes, they are programmable.
So what if we buy these this year and like 2 new diseases come out
It,
within 6 months, or COVID-20 comes out, not COVID-19? Does
it's,
it work?
it's still a virus and it attacks the molecular structure of the virus. And if you look at your paperwork, it literally blows it up. UV lights basically blow those up on living surfaces.
See,
Huh?
Yeah.
I know.
But Brian can add something to that.
This is a germaphobe's
So
nightmare.
Now, let me ask you another silly question. If this thing is that good, how's it test out on bed bugs?
Oh, my God.
Why are we laughing?
I'm not laughing. I just know that's your thing.
You know, to be honest, I am not sure if it has any effect on bed bugs. With the viruses, what it does, and the xenon bulbs and the technology within this machine, it essentially is a different frequency than other UV bulbs and some other UV sanitation. And the xenon wave essentially, like Mr. Barron said, attacks the viruses at the cell level and the molecular level and destroys them. Other UV technology essentially weakens it, and then within a certain amount of time of specific virus, it can regenerate itself. But the xenon wavelength actually destroys the cells of the virus.
Okay, when that bulb goes bad, do you get an automatic signal to tell you it's done?
Yes,
It
actually,
gets put out of commission and gets locked away?
actually the company notifies you when you're getting close because the bulbs are rated for a certain amount of pulses, and the company simultaneously tracks the usage of the machine through their software, and they will notify you when you're getting close to a bulb replacement, and that maintenance contract, then someone from the company comes out and actually replaces the bulb in the machine for us.
You answered all the questions I need. Thank you.
I was just going to make a motion that we recommend the purchase of killer robots.
Well, but
That's what they are, right?
there's another item that's on there.
Okay.
Sorry.
Well, no, I mean, look, in all seriousness, I have, obviously, I think this is we're in the middle of a concern, and I think it may have woken up people in general that this could be tied to climate change. I know some people don't want to, it may not be, but we may be looking at more of this down the road. Hopefully not, but, so I mean, I can understand the thinking behind it and the wisdom. I guess coming at it from a fiscal perspective, again, I think medically, it sounds like everybody's done their homework, but my concern is generally when we do things, we get it's sort of like you buy the car, but they immediately want to sell you the protection plan. You know, then when you take your car in, the protection plan doesn't happen to cover everything they sold you on. So I guess my thing is, how long is the warranty for? And we're buying this plan, but how many years is that for, and do we then renew it?
So for the phone soap thing, which is actually not soap at all, it's a kitschy name for the company. Their bulbs in there, and I'll explain what that device is next, but their bulbs are lifetime for the life of the device. The robots, you get it's the 3-year maintenance contract on them. And we will probably renew that every 3 years.
But you don't know what that amount would be then?
It's $30,000, I believe.
Oh, $30,000 for 3 years?
So it's 55 for the being and 30 for a 3-year contract.
Okay. All right, I just was curious.
Is there somebody from the company that could come?
Well, right now, there's so as you know, there's supply chain issues with all these devices. We're purchasing them from Medline. We wanted to get this in front of you to spend the $1.9 million. We'd be happy to check with that, and if it's not somebody from Solaris, maybe somebody from Medline who does the actual on-the-ground sales of these devices. We could do that at a future date. But right now, we wanted to get this resolution in front of you because you'd been asking about the 1.9 million, or the 1.9 million, and we have very few meetings left. And the concern is about the supply chain. which leads me to the 300 other things we're going to be purchasing with your approval, hopefully. It's called the Home Soap device. What it is it is a UV self-contained box. It has an automatic cycle of 10 minutes. You could put any electronic device, cell phone. You can put a cell phone in it. You can put your electronic mouse, any remote controls that you have laying around. You can even put a baby bottle in it with milk in it. It does not heat up. It actually just shines UV light into it to make sure that there's no bacteria or viruses on the surface of the item. We're purchasing 300 of them, obviously for our buildings. We want to make sure that each municipal building in the county gets one of these, along with community centers and potentially senior centers when they're able to reopen. So our hope is to be able to purchase these. We'd like to place the order where they're able to produce the devices and they have them in stock right now. We are going to be buying 300 white home soap devices, and what you do is they have a manual cycle and an automatic cycle. You put your device in. If it's on the automatic cycle, you close the door. After 10 minutes, the light goes out and your device or whatever you put in there is sanitized. It is a UV bulb that is a lifetime guarantee, and it does not get hot. It also sticks. It has a special plastic sticking device so it doesn't top over or tip over. So we believe that this is the best device to get sanitizing equipment, and folks who might not necessarily, everybody has a phone. Everybody has a remote control, maybe a mouse or something. If you want to get that sanitized, we can get that at community centers and in places where people frequent, so that they can clean their devices and know that they have a sanitized surface while they're using their phones or whatever electronic device they have. Well, the cost per unit retail is $199. Because we are buying 300, the price is $160, no tax, and there's a freight charge. So the total to us would be about $49,000. It's 48 and change, but we'll round up to $49,000. Well, no, this is just for the home soap. Yes, absolutely. Yes. And then the two other items that are listed in the resolution, we talk about other UV or traditional cleaning technology that might be out there. We are also looking at getting portable video conferencing. The portable video conferencing is actually for the court services, or to be able to get the public defenders, DA, courts, if they have to social distance outside of a courtroom, to have the ability to do that mobily. IT has geared up and has put that together. We're definitely looking at one, potentially two of those units. And the second item on there is actually a virtual classroom, like a conference room. It will be located in fiscal affairs on the second floor. We were putting together a conference room or a larger conference room anyway. So what we decided to do, and Mr. Cusick, who is on CCAP with the assessment folks, will know that when you go to your continuing education, you have to see the person. I made the joke today that, the people holding their IDs up into the phone or into their computer so people could see that it was really them there and they had the ID with the name. It looked a little silly, but that's the world we live in now. This virtual type classroom will be able to allow us to get folks trained to be assessors, allowed to train to do any kind of licensing and state training where they're required to be on video. The state is going virtual, and all of their trainings now are going to be where the person is going to be watched on video. So they know the person who's taking that test or doing the certification is the person that's actually doing the certification. This will allow us to do that in a socially distant manner. And that is what we are looking to spend the remaining $1.9 million on.
Yes, sir.
Barron, do we have, I mean, fine and good with what you did, but where are we with just the old-fashioned, normal, day-to-day PPE? I mean, are we okay with that before we spend the money on the?
Mr. Weaver is here. A lot of that is being handled at the state level, and it's going through the emergency management groups.
I just want to be sure that.
Todd, if you want to.
We have on hand what we anticipate we may or may not need.
The expenditure of these funds on these particular items, which I can tell you based on some of the reports I'm receiving, are vital to us to be able to continue the day-to-day operations of the county. To specifically answer your question, today, we're fine. We anticipate being fine with our PPE for the near future. Todd does an excellent, Mr. Weaver who's here, does an excellent job. Ms. Stewart King is a magician as well at obtaining personal protective equipment. So I am confident going forward into the near future, we are fine.
Good. I mean, because I agree.
But by the same token, though, you know, I'm not going to cry with a loaf of bread under my arm. We're going to continue to aggressively pursue personal protective equipment on a daily basis. We just don't ever stop.
Yeah, I fear I fear this surge we've seen, and I saw Pennsylvania showed red. I mean, I'm concerned until we get somewhere into next year, we're going to see, and just so we're ready day to day with that, I'm fine. I just wanted to be sure
No, all of the indicators are flashing red. Our own site is around 8% now, which was under 3 when we started with coordinated health. So that's a bad sign. It's going in the wrong direction. You're seeing hospitalizations tick up. You're seeing all of these things, you know, tick up. So I mean, we just have to. You mentioned before about mask fatigue and the Mask Up campaign, and you're absolutely right. A lot of people have given up sort of this fall. They've given up. You see them on the weekends. You see it on Facebook. Everybody cheek to cheek without their masks on, taking pictures. You look at the age cohorts where the rise in infections is taking place, and it's in folks who are socializing, be it at a bar, restaurant, or at their homes with large groups of people without masks, thinking being outside makes you, invulnerable to the disease. It is not true. The fact of the matter is approximately 85% of the people who died in Northampton County thus far from COVID-19 were in congregate care facilities. Right. Yeah. That's true. Like I never back away from speaking the truth about that. It's also true that folks 65 and older are most vulnerable to infection and having severe outcomes from COVID-19. But hey, guess what? People in the 25 to 49 cohort, your moms and dads are in the cohorts of, and your grandparents are in the cohorts of the people who suffer the most severe effects of this disease. So, we all, in Northampton County though, we've all done a really good job at taking care of each other. We really have. I mean, you could see it with your own eyes while you're out there, but people got tired. And I think with the Mask Up Lehigh Valley campaign and with our own leadership, we can continue to do well. But we're starting to see, to Mr. Meyer's earlier point, we are starting to see people, employees, getting infected outside, not inside. They're not getting it inside. They're getting infected outside, but then they come to work. Right? Yeah. So we're going to see this based on the governor's recent directive from the down through the Department of Health. We're going to have masks on all the time now, irrespective if you're 6 feet apart from one another or not.
Yeah, and I mean, I agree, because I was watching C-SPAN. You pointed out fairly who's the fatalities and where they are for the most part, and I agree. But also that this particular virus, even the people that got it early on and were asymptomatic or didn't have it hard, they're concerned about some things that are showing up in these people, even what were otherwise relatively healthy people, as a consequence. So I think their point is, we don't really know enough to just say, well, you didn't die, you're great, you're lucky, good for you. If you were infected, and you seem to be healthy now, they were by and large internationally saying that there's a concern. We just don't know enough about it. So, yeah, I agree with you. The parties, I mean, Mr. Myers knows his beloved Easton Peaburg game is now kaput. So, I think we're taking appropriate measures, and I'm just glad to hear that we got all our bases covered, and I have no problem with Mr. Barron's Skynet plan to keep us safe in the modern age.
Okay, so,
I just think it's awfully important. We need to be aware of that, there are things coming down from New Jersey state legislation that they're telling people, unless you're working in Pennsylvania, they don't want you to even travel.
Well, Pennsylvania's done that as well.
Pennsylvania's doing the same.
Right, Pennsylvania's done that as well, and as you know, we have many employees who live in New Jersey, but those rules don't apply to them. Mr. Weaver, today, is Todd still here?
Yeah.
Good job, Todd. He just finalized an addendum to our agreement with Coordinated Health such that our employees do not need a symptom now to get tested at our drive-through. So, and this is going to become critical because of the travel, so that they don't have to sit at home for 14 days when they're not sick, quarantining. If they get their test 72 hours before they come home, well, they're good, right? But if they come home, they're going to have to sit on the sidelines, and if they don't get a test, they're going to have to sit on the sidelines for 14 days. But if they get a test, and it's negative, they can be back in 72 hours. So it was important that Mr. Weaver concluded that agreement today. It's important that, we enforce these rules because we have an obligation through this pandemic to continue operating this government.
Absolutely.
so prior to moving this forward to tomorrow night, if that's what the committee cares about, can we get an itemized list rather than just the 1.9? Could you do a breakdown for us for tomorrow evening?
I could have an Excel spreadsheet for you with the breakdown, yes.
And again, I don't think we're going to hold you to be hard and fast, but for those who aren't here, who weren't part of this discussion, it would be helpful. Did you want to make the killer robot authorization, or did you?
I'm ready to move it on.
Okay.
Motion to recommend the purchase of killer robots.
Look, I am.
I know you waited for an hour to say.
I just want to make a statement. I think I'm tickled to death to see that we're being as aggressive as we can to try to keep this thing in check and take care of our people and take care of everybody else. And as long as we're taking care of county employees, that's fine. And make it available to some council members too, please.
Steve, could you get some plexiglass in that pile too, so we could extend these out and not breathe on each other?
We are, Mr. Myers, I think it is not an exaggeration to say we are on the precipice of a situation that is out of hand in terms of infections. And then, what happens in the hospitals happens, and then I imagine the state government will react from there, but.
Right. Our main responsibility is service and safety, and I think, I personally feel that everybody working together here, at least at this level of county government and a bipartisan effort and whatever, has done everything possible and is doing everything possible to secure and be safe. So I applaud the efforts, and hopefully if it saves one life, then great.
Okay.
That, and we'd have to give the money back.
Moving on.
Thank you for the support.
Moving on.
Move it, please.
The Zoom meeting stuff that we're gonna have shortly, is that part of this grant too, or no?
No.
Does that come out of our budget then?
Yep.
We're gonna talk about it.
Okay, okay, good enough.
It's placed in for the contingency fund. It'll
Okay.
just move faster that way.
Okay.
Okay, so let's get on because we have some people that have been patiently waiting and we have our own business still. Review of a 2020 contingency account transfer to purchase a license for Adobe Acrobat Pro license for use by county council staff. This was requested as a result of my request to streamline the emails that we get. Aileen's here. Do you want to talk about it, or?
Aileen, do you, actually, she might as well come forward because she might be asked a question about the next one, software. So I don't know if there's a need, if anybody has any question for, it's, it's
No.
written here, but.
just asked her to look at how we streamline getting some of our information, not double up. She suggested this is an easier way to view it, how she could send it to us, so we would just require the purchase of a license.
Right. $350, I mean, $400 basically.
Motion to pass forward then, if there's no
Motion.
question?
Thanks for looking into it, because it is a challenge sometimes.
Thank you. And then
Anything
the
to make it
second-
easier,
Sorry, Bill, go ahead, finish your thought.
that's all.
Second is therefore be it resolved, the 2020 contingency account transfer to purchase a Zoom license. Do you want to speak about that?
This, Ms. Shafnisky and I have had a discussion, and in fact, we did a test. So, and using the IT department's recommendation, there's different Zoom platforms. And the test we did was successful. And my concern with this, and she can address it to any council members that have a specific question, is I agree with everything that the county executive just said, and I don't want to be pessimistic, but I believe we're going to see it get a little worse before we come out into the dawn. And I don't know what that means. We may not be able to continue doing this. We've already had, not related to this necessarily, but, COVID situation. We may have to go totally virtual. And the concern has been, not that we can't be on Skype, but if we have to do it, for example, in December, the most important part of our meeting for a county council governmental entity is courtesy of the floor. And it does no good to have 9 people being able to talk and see each other if we can't provide that. So we're looking to spend $139.10 from our this 2020 contingency to purchase the software license for use by county council and their staff. Would you like to speak to that as to why?
I think most of you have experience with either, if not Zoom, one of the other platforms. We are going to buy the license so that we can hold the longer meetings. The free version's only an hour, so.
And this would not be hooked into any county systems. You would be going home, sitting, what?
The microphone so I can hear you.
Oh, I'm sorry. It wouldn't be hooked in to county systems. So we'd all be able to sit at home, and we'd all be able to chat, and we'd probably have a moderator, which would, no doubt, I've talked to the staff, I've talked to Ms. Zembo about this at length, and Ms. Shafnisky has been getting herself familiar with a lot of the IT stuff, and she would probably end up moderating meetings. But I just want to be prepared, because I don't know where we're going to be in the beginning of December.
And just so you know, it will also have the capability to live stream on YouTube while we're
Yes.
doing the meeting.
That's a great point.
Whoa, wait, in other words, we have no delay.
Well, people will be able to
There'll be a
watch.
delay, but
A little bit, but not like,
You'll see yourself, but there'll be a delay to the video.
Yeah, and it may be better to not watch yourself on the YouTube and to use your computer, but people can watch. And then there is also the fact that will be able to come in and access, in terms of courtesy of the floor, if there's open discussion on a ordinance type thing.
well, that's a good thing, because just a couple weeks ago when I had to stay at home,
Yeah,
I could hear, but I could not see anything that was
Right.
going on.
and then,
That's a nice plus to have.
and it's just more of an emergency situation. It's not a lot of money. I mean, and next year, hopefully, when what's the name of that patch or program?
Clarity.
Clarity gets in and everything's set up. If we have another situation, by then, we'll be able to have a full-blown operation.
Well, Mr. President, how does the staff feel about us going with Zoom? They're good with it? Linda?
Which, our staff here?
Our staff.
Our staff.
We have to go, so we'll deal with it.
I thought you summed it up well. So,
Okay, it is what it is, okay.
are there any questions for Ms. Shafnisky?
Not really a question,
Are you running the meeting now?
Thank you.
Oh, I'm sorry. I
Go ahead, I'm
Madam
like too intrigued.
Chairman, I'm finished.
He did that
You're supposed to
presentation.
do your presentation and then zip it. Thank you.
You have to remember, I'm a product of the patriarchy.
Okay.
And
Mr.
so,
Cusick, did you-
it is what I am. I can't help myself. I
Want to ask her a
apologize.
question so she can get off that leg?
Yes,
Are there any questions for him?
Just a quick point, I started with the free product back in March, And earlier this year, we did buy the license. And there are a lot more features that you have access to as part of the licensed version. Have you had the chance to work with both?
Oh, yeah, yeah. And
Okay,
it-
so you have seen a demo of the
Oh,
licensed
yeah, yeah.
product?
We
Okay,
set up
good.
an internal call and.
All right, good. Yeah, so I'm going to support this.
Okay. Would that be in the form of a motion to move forward?
I will make a motion to support this.
Thank you.
Madam Chairman? Did I ask Tom, or I wanted to ask Tom how he felt? He's our IT man up here, so.
I use the product, we use the product all the time. Zoom, we use Teams, we use the various, they all work well.
Yeah, and if
I mean,
somebody,
it's right
if I
to
may,
work
if
well.
somebody inappropriate gets on.
Sit down.
Just like the meeting, you can leave, they can be dumped, she'll dump them. Yeah.
Right.
No, I guess,
Well, I just want her to sit down. I'm fine, you keep talking, so to say. Yes, thank you. It's done, it's moved, we're doing it.
Comment.
Thanks.
I have a
Yes.
comment after the fact. It's moved.
ahead, as long as
I just
she's
want to
sitting.
thank the staff for looking into this, because we've been talking about it a long time. There's a lot of features on there that I think will help the public engage in public comment, such as Mr. Heckman spoke. You can raise your hand. There's a lot of, I've seen other counties, I've already participated with other counties with this product. And I think we're one of the last ones that are still here. So, thank you.
So we're really moving into the space age today. Here we go. And then Article 13, contracts. I apologize to these vendors who are here for making you wait so long. APCO International. Protocol guide card system for EMFNP incidents.
Good evening, council. It's actually, we refer to it as APCO, which is the Association of Public Communication Officials. And what this software is, in March of 2019, the State 911 Advisory Board with PEMA has adopted new training and quality assurance standards. We currently operate with what we call medical protocols, which are the instructions that we give before and after a 911 call for stopping bleeding, CPR, and so forth. The state has added, as part of the directive, that we added fire and police protocols. And at the same time, while we're doing that, we're actually switching our protocols over to APCO, as we refer to it. And part of the reasons on that is that we have about 8 to 10 APCO instructors. Right now, with our current protocols, one of our delay in getting dispatchers moving is we have to bring in outside instructors for our current program. Now we can actually do a lot of training in-house, and then with COVID, you know, the timing is just right, that we can keep that all within our organization. All of this is funded by the State Interconnectivity Fund. We already have part of those funds already in our account, and it is basically in the form of a grant. And it's kind of us matching within our Northeast region. Most all the other comm centers that are in our Northeast region are already on APCO, and we're looking to move there just so it's standardized across our region.
So then explain, how much is coming from our actual budget?
None is actually coming from general funds. It is all coming from the state 15% interconnectivity fund.
So it's passing through?
It's basically, what it does is we pay the upfront. Only the last portion or milestone of this project is our general fund, and they reimbursed us in probably less than 2 to 3 weeks. They release the funds as soon as we close out the project.
Any other questions? Motion to move forward?
So moved.
Thank you. Next Level Administration is our next contract. Workers' Comp Claims Administration Services?
So we currently have a contract through January with Next Level Administrators, and I am recommending that we carry that contract on with them. We have a great partnership. They have helped us save money drastically since 2015 when ACS, who was the original company, started with us. We did interview a couple companies, and they provide the most savings to the county, the most flexibility, and are very upfront with their contract and their fees. So, you know, nothing's hidden. It's all a flat rate, which we like here. I do have Karen McKendry here. She works for Next Level Administrators, so she won't be able to be here tomorrow night. So if you have any questions for her tonight, I wanted her to come up and just give a brief overview of her company, and then feel free to ask her any questions.
How long is the contract for? I'm sorry, I didn't.
It's a
5
5-year, yes. And
Thank you.
The previous one was a 5-year as well. So as Kathleen said, I'm Karen McKendry. We had ACS Claim Service, which was a company around for 25 years, servicing the self-insured market along with contracts. We merged with Next Level Administrators in 2018 to be able to take what we had and expand it for our clients and to be able to provide more services to them. We merged with them particularly because they had the same philosophies that we did. We keep a very low claim load compared to our colleagues so that they can really be on top of your claims and provide the best service to your injured employees. So because of that, they're also very conscientious of the county's monies and how they spend it and making sure that they save as much money as possible, which we've been able to realize over the last 5 years, not only in terms of reductions in expenses, but also in amount paid out in benefits by them being on top of their claims, so.
Question?
Yes, sir.
How many other places, how many other people do you service in the local region?
Within this area-
Contracts, the contracts. Do you have any other government contracts, or just a little snapshot of your?
Sure. So Next Level Administrators actually services 50, almost all the states. We are their Northeast branch, located in Pennsylvania. And we have 3 other self-insureds currently, but we have a large number of different staffing companies and PEOs that we do service for as well. We have 2 adjusters, actually 3 dedicated to the county to service. We do that so that there's coverage there. If one's off, the other knows the county and all the procedures and all the individuals here that they communicate with.
And you are our incumbent now?
Correct.
Okay.
Correct.
That's all I have. Thank you.
You're welcome.
I just have one question. So how do you, are people using your physicians or physicians that you've established? Like if they have to go for follow-up visits and stuff, you administrate the claims and you
Correct. And that's-
verify, correct?
Correct. And what we did when we started and also throughout, we always monitor these. In Pennsylvania, you're allowed to have a panel of providers. And we had looked at those providers to make sure that they were providing the service we wanted, that they were prompt in appointments for the employees. And it also allows us to kind of control that a little bit. We have close communications with the providers so we can let them know that there's job availability for modified duty, which has saved us a tremendous amount in terms of benefits being paid out from lost wages because we can get them back to work quicker. But we continually monitor that provider list.
But
And
they are local.
they are all local. Yep.
Go ahead,
Oh,
Mr. Busey.
Just one quick question for HR. By any chance, did PCOMP submit a bid for this? And if not, why not? Did they look into it?
No, there were 5 responses and PCOMP was not one of those.
Did they take a look at it, or do you know?
Not that I'm aware of, no. I looked at the 5 companies that submitted the application.
Okay, just wondering. Thank you.
Yeah.
Any other questions?
One more. On subrogation, I see it's in here. So you do a due diligence process on subrogation?
Correct.
Okay.
Correct. And where appropriate, then we do send out lien letters and also make sure at the end that we negotiate any potential sub-row, so.
In the past 5 years, how many workers' comp claims have we had?
Total in the last 5 years, so on an annual basis, we average about 150 to 160. It
Wow.
was a little higher than that before. Actually, it was 250 right before we started. And we've worked, I think, with our thorough investigation and our communication with the employees and everything. They know that, everyone knows that we do a very thorough investigation up front, and that helps in the overall cost and of your claim and the potential outcome.
Thank you. Any other questions?
Motion to move?
Thank you, sir. Thank you for being here tonight, I appreciate
You're
it.
welcome, thank you.
And last is Remedy Senior Care, which should be pharmacy services for Graysdale.
Yes, the contract with Remedy. Is,
Sorry.
that's okay, is set to take effect January 1st. Just so that you are aware, this is not the incumbent. When we were evaluating the RFP bids, Remedy really stood out as a company that could really help along with their innovative technology that they're using within their pharmacy facilities, as well as some very nice new packaging, which on our side helps with ensuring that medications are packaged appropriately and basically mitigating the risk of medication errors, as well as speeding up the time that it takes our nurses to perform med passes, just because of their packaging technology that they have. And obviously that translates into less time of a nurse passing meds and giving them the ability to spend more time performing care and attention with the residents. Tonight, we have Jeff Stamps, who is the president and CEO of Remedy, and Libby McDonald, who is the senior VP of Account Services. So I'll have them come up and they can kind of tell you a little bit more about what they do.
Thank you. Sorry I fragilized your name. I did.
That's fine, no problem. We go by any name that people call us, so.
That's all.
We're the pharmacy, that's what people call us, so.
You're better than I am.
But, yeah, Brian, thank you, and, appreciate the opportunity to be here. As Brian said, my name is Jeff Stamps. I'm the president and CEO of Remedy. I'm a pharmacist by trade. Libby, who's with me, is a nurse. And we do have I brought a sample so you could see what Brian was talking about. So it's a way too long of a conversation to go through all the things that Remedy provides for Graysdale. But I think one of the important things, we certainly heard a lot tonight about infection control and COVID and so on and so forth. And our system is a disposable system, so you use it and then you dispose of it. So the infection control benefits, in addition to what Brian's already mentioned, and then really a myriad of other services that go along with what we provide for the pharmacy or for the facility. And just a little about Remedy, we provide services in 30 states. We service a little over 40 accounts in the state of Pennsylvania. Those are both skilled nursing facilities and assisted living. And then we also have a home care division as well. So we have 13 pharmacies that are located regionally, from Colorado to Florida to here in this area. If there's any questions, it's a very complex contract, as you might imagine, to provide what we do 24 hours a day, 7 days a week. But if there's any questions that I can answer for you, be happy to do it.
So are you providing all of the pharmaceuticals or just the over-the-counters? Because I see the over-the-counter list, but then I see an infusion list. So you'll be providing all the medicines for the entire facility?
Yes.
Let me finish my last thought, and then I'll get you guys. Does that include vaccines or no?
It would include vaccines, yes.
Okay.
And we also are coordinating, given the discussion about COVID, I'm sure everyone's heard the great news this week about the efficacy of the vaccine. Very exciting technology that they've used to develop the vaccines. And we will coordinate with the various providers to provide both the COVID vaccine and then the flu vaccine or pneumococcal vaccine, those types of things. We provide that as well.
Shingles, et cetera. Okay, questions, I'm sorry, Mr. Heckman. I see McGee and I'm gonna call Heckman, sorry.
Either one of us. He doesn't mind.
Yes, he does, but.
All
we
right,
can wait.
no, just a couple questions. One is you mentioned the 30 states you're in and your accounts and as personal care homes, but you do nursing homes though, because our nursing home is particularly I guess I'd say high risk. I mean, we have really people who need a lot of care, and you're familiar with that type of
Absolutely,
situation.
that's our expertise.
Okay.
Yep.
And the other thing would be, so your system is similar in that it's prepackaged in packets, and there's a barcode, the nurse could scan it, and then she scans the patient's wristband, for example, and you're able to match, so we're sure everybody's getting exactly what they're supposed to be getting.
Yes, there's a series of barcode checks throughout the system, both at the pharmacy
Okay.
and there was a mention earlier about point-click care, and when Brian was talking about the nurse that was going to be added to the staffing to coordinate point-click care, we're interfaced with that technology, so all of our information comes from the facility to the pharmacy in real time. And so as soon as the physician, makes an order at the Gracedale facility, it's in our system immediately.
So they're intertwined with your system, so doctor comes in, he says, oh my gosh, I want this and this and this changed. You put that in your system and he gets it automatically.
Correct. Their software is integrated with point-click care.
Okay, great. And the final thing I wanted to ask was, and you touched on it, obviously when this vaccine comes out, and I don't know which one, I know the one is a lot easier to handle than the other one.
Yes.
They both sound like they're in the same range as far as efficacy goes. But I would assume, at least we believe, that the first line responders and people such as the folks that live at Gracedale would be some of the first that would receive it, the highest risk groups. Would it be your organization that would coordinate that with whoever, whether it's from the Fed or the state coming down? Because, I mean, apparently we've been told this is going to be coordinated at some level above us.
Sure.
And it's going to be, nobody's going to pay for this, at least out of their pocket. Somebody will pay for it eventually, I assume the feds. But, I mean, would that then funnel, when that happens, will that be going through you?
Yes.
Okay, so you would be administering and you would be sending?
Well, the administration would be done by the nurses typically.
Oh, no, I know, but I'm just saying, you're the pharmaceutical group that if a supply were to be set up for Gracedale,
Yes.
it would be coming into probably you'd be the one handling it and then sending it through and you'd
And
administer it.
it will be allocated for the staff and the residents. So the healthcare workers, frontline healthcare workers
Yeah.
are in what's called the Schedule A to get it, as well as the residents of all skilled nursing facilities and assisted livings.
I'm sure you don't have the answer to this, but any ideas on when you're kind of operational, get the first vaccines? I mean, I really want to see it get into the very high-risk population.
Well, they're submitting, Pfizer submitted for the emergency authorization use yesterday. Those typically don't take very long. Their vaccine is the one that is the ultra cold storage.
Yeah, I mean, I don't even know if we'd be able to handle that.
Well, the government's going to, they have already contracted for the services around the ultra cold.
Yeah.
The second vaccine, which seems to be equally efficacious as the Pfizer vaccine, that one doesn't, it just requires regular freezing.
Yeah, I guess you've answered my questions. I just, given the reality we're in right now, or the new reality, I just wanted to get a sense of, I mean, for me, the big thing is going to be, once this thing, they say, okay, now it can go out and it's available, if we're prepared for whatever we get, that we're going to be able to move forward and get it to these people.
We would, absolutely.
Mr. McGee?
I just want to add one thing to that. Like Mr. Stamps had alluded to, that the government has kind of already got the ball rolling on this. CMS and the federal government have already, they've had discussions with supply chain and things like that, specifically with CVS and Walgreens, in order to roll it out nationwide. Remedy, obviously can assist with that, but the federal government, like he had alluded to, is allocating, obviously putting, facilities like ours and healthcare workers at the priority, and through like the conduit of like large national pharmacies. But yes, Remedy can assist with that. The first wave of vaccines, the federal government is offering assistance with staff to administer the vaccines, as well as ensure the cold storage. But yes, going forward, Remedy is a partner in that process.
Yeah. And to Brian's point, we are coordinating with Walgreens. So all pharmacies that are currently in this space are going to coordinate with one of those two providers, CVS or Walgreens, and we've already, we had been working with Walgreens prior to the announcement, but that will be the provider that we'll coordinate with.
Thank you.
Thank you. Just a few questions. So I know you're not the incumbent, but I have a lot of confidence in the Graysdale team vetting their vendors. The $720,000, that's the administrative fee, right? So that doesn't cover any of the drugs, right?
Yeah.
The 720 is an estimate based on our past expense that we've seen from the incumbent. The actual pharmaceutical cost that we will incur is very resident-based, because a lot of the residents can be charged through insurance that they currently already have. Our expense comes in through like a consultant pharmacist that Remedy will provide, as well as residents that, such as where their insurance won't cover, and it's the facility's responsibility to pay for the medication. So then that's where we, Graysdale, would then pay for the medication. But this figure here is the estimate based on what we've seen in our previous usage.
Is that admin and drug, or just admin?
That's consultant pharmacists, that's medications.
Oh, it is medication?
Yeah,
Okay, that's an average, that's
Yeah.
a assumption.
correct.
Okay, and with that assumption, when there's rebates on drugs, now I know most of the time the government's paying for some of the drug, but do the drug rebates come back to the county at all? Or is that any part of the contract, or?
Well, obviously, we took rebates. Rebates are typically volume-based, based on what the pharmacy purchases, not based on what the facility purchases. So, and that applies to what the facility buys, as well as what we bill to those insurances that Brian was speaking about, most of those being Medicare Part D. Rebates have declined pretty significantly, because if you look at the average utilization of prescriptions in skilled nursing facilities today, about 90% of them are generic. And most rebates are on brand drugs. And so
Right, until they go to the generic, there's an opportunity though for rebate.
On brand drugs, there are. On rebate, on generics, typically there is not.
So is that built into these prices that you've put in? I see you have some prices. Are
Exactly.
the rebates are built in, or is that an addition?
They're built into that,
They're built into your price?
yes.
Okay, that was my question. Thank you.
Mr. Myers? I'll get you.
Just getting back to, once these drugs become available, that we're going to be giving to our people at Graysdale. Now, you're going to be handling that, or is that going to be coming through, are they going to be handling, making sure our people get inoculated and everything else can be done there?
Well, there's,
No?
if you're talking about the COVID vaccine.
Yes.
Okay, the COVID vaccine, the ultra-frozen COVID, the federal government has contracted with two pharmacy companies to do that, Walgreens and CVS, to do all skilled nursing facilities across the United States. Those other pharmacies, like ours, will be coordinating with one of those to provide support services, which will need information about the residents, diagnoses, those kinds of things, to make sure that they have what they need. And as Brian mentioned, not only will there be those pharmacies providing the pharmacy services in coordination with us, but there'll also be administrative assistance for the facility staff to actually give the injections.
And all that's going to be run by whatever doctors we have going in and make sure that we're handling this correctly, right? Our medical staff's still gonna be on top of all that, correct?
Correct, yes.
That was my biggest concern, okay?
Mr. Cusick, oh, Mr. Cusick?
Yeah, real quickly, where is your facility located that would service Graysdale?
Baltimore.
Baltimore? Do you have Pennsylvania licensed pharmacists there and?
We have a number of Pennsylvania licensed pharmacists throughout, I mean, we provide services to a number of accounts in Pennsylvania. And given the specialized nature of what's required in skilled nursing facilities, it's not unusual to have pharmacies that are longer distances away from facilities. We also install electronic medicine cabinets in the facility throughout.
Pyxis, you
There-
fill the
We
Pyxis?
use a version, it's a different company, but it's the same kind of technology, yeah.
Okay, thank you.
Mr. McGee?
I don't know this business, those folks do, but I would like to ask this question. Supply, service, those are really important to us, right? I know money's important, but the supply and the service, running out of something. So your vendors, the people that you get supplies from, you can handle this kind of thing.
Yeah, our primary vendor is McKesson, which is one of the largest distributors of pharmaceuticals. McKesson, Cardinal, are probably the two biggest. AmerisourceBergen, those are the three. AmerisourceBergen.
And if you can't supply it, what does the county do?
Oh, we can supply it.
Okay.
I mean, we're available 24 hours a day, 7 days a week. If there was something we ran out of, we have all kinds of networks that we can work through to make sure that we have drugs available. I mean, unless a drug is nationally out, we're gonna have it. So like, whenever COVID was full on in March, April, May, there was some shortages of a few, mostly nutraceuticals like zinc and vitamin C and some of those kinds of things. So if the drug's available, we'll have it. And then if it's not, then we'll, suggest an alternative for the physicians to use.
Where's the closest facility that you have a contract with currently?
We have a couple in Philadelphia. Libby's probably better at this than I am. We do, a lot on the western side of the state, Libby.
She needs to come up. You got.
Okay, go ahead, Libby.
I'm not going to tell her that. She knows she exists. We just can't hear her.
Well, we service one in Corryville. And it's not, I think it's a little south of here, but.
Lancaster County.
Yes, Corryville. Then a couple up in the Philadelphia area, and really all over the state. We service about 40 facilities here in Pennsylvania.
Okay. Any other questions? Motion to move forward?
Motion to move.
Thank you, Bill.
Thank you.
Thank you.
Welcome.
Any other pressing business?
I don't know, what Mr. Barron thought of something.
Oh, one question on the Zoom.
It's like,
On the Zoom, when is the Zoom actually going to be up and running? Our Zoom. We have to train for it,
Aileen's
right?
not available.
I would say this.
I guess when we buy the
It will be-
license.
Theoretically, it can be up and running at any time. I mean, we did a test, I'm gonna do another
Okay.
test with her probably Friday. And I think the few of us can get together, it'll be the testing of the fall.
Okay.
I think Tom would agree. Technically, it can be done.
Thank you
We're
for your
getting close.
patience.
Okay, good. Thank you.
Adjourn in the meeting. Thank you.